So hello students. Hello students. I'm Dr. Pradeep Pawar, Professor of Anatomy, and आज डिस्कस करते हैं कुछ MCQs एनाटॉमी के बारे में. तो लेट इट बी एन इंटरैक्टिव सेशन. बच्चों, इंटरैक्टिव सेशन करते हैं. मैं कुछ पूछूंगा, आप कुछ आंसर करिए. So let it be an interactive session. So it will help you to understand better, and it will be easy for me to explain things. Right? We'll start. Okay, chalo. So bachcho, we'll start with the first MCQ. Have a look at this. We'll start with the first MCQ. Identify the pointed tendon. Any guesses? Any guesses? You can tell me. Answer बोल सकते हो. Identify the pointed tendon. चलो बच्चों, क्या आंसर किया आपने? What have you answered? चलो चलो चलो, answer. Okay, so let me start. Sure, I'll start. What is this? What is this area that you're looking at? ये क्या area है? That's the anatomical snuff box. Anatomical snuff box, right? Now, for the anatomical snuff box, what is this boundary? What is this boundary going to be? The lateral boundary. Lateral boundary. And ये क्या boundary होगा? Medial boundary. That's a medial boundary. है ना? एक lateral boundary, एक medial boundary. So, बच्चों, you have to understand the boundaries of anatomical snuff box. Boundaries of anatomical snuff box. मैं एक बहुत easy way देता हूँ आपको. I'll explain it in a very easy way. The anatomical snuff box. Have a look at this. Yeah, radius. Head of the radius. Okay, one moment. That's the head of the radius. Neck of the radius. That's a radial tuberosity. Your head, your neck, your radial tuberosity. That's the shaft of the radius. Styloid process of radius. Styloid process. Here ulna, and that's the styloid process of ulna. Right? This is the styloid process of ulna. एक मिनट, I'm not able to see your comments. आपने कुछ comments किया है बच्चों? Okay. So what is attached to this radial tuberosity? What is attached to this radial tuberosity? Anyone? इसमें ना एक MCQ डिस्कस करता है तो बहुत सारे MCQs उसके साथ हो जाते हैं. There are plenty of MCQs which gets done with this. Okay. I couldn't see your comments. ठीक है, अभी I'm able to see. Hello, sound issue है? Yes, Rahul. Refresh करिए Rahul. So what is this tendon of? बच्चों, this tendon which is attached to the radial tuberosity. Any guesses? That's the tendon of biceps brachii. अब how do you remember this? देखो, this is a muscle which begins from radius and ulna. ये दोनों radius and ulna से begin होता है. What is this tendon of? That's the abductor pollicis longus. This tendon is abductor pollicis longus. Okay, there's a muscle which begins from radius. एक radius से arise होता है. This extensor pollicis brevis. अब कैसे याद रखोगे बच्चों इसको? Abductor pollicis longus and extensor pollicis brevis, they go together. They are on which aspect? अब ये radius है. This is the radius. So which aspect is this? Lateral aspect. So ये याद रखना बच्चों, lateral side पे there are going to be two tendons. Anatomical snuff box का lateral side पे दो tendons होंगे. Abductor pollicis longus and extensor pollicis brevis. Correct? Now what is this muscle which begins from the ulna? Extensor pollicis longus, and extensor pollicis longus will be single. So ये ulna की तरफ से आता है. It comes from the ulna, so it is on the medial aspect, right? So boundaries of snuff box laterally is going to be abductor pollicis longus, extensor pollicis brevis. Medially is going to be the extensor pollicis longus. तो ये tendon क्या होगा? Extensor pollicis longus का tendon है. This is the tendon of extensor pollicis longus. So what is the floor of snuff box formed by? What is the floor of snuff box? ये पे खत्म करते हैं. So the floor of anatomical snuff box is formed by the styloid process of radius and two carpal bones. ये कौन से carpal bones है बच्चों? Scaphoid and trapezium. Scaphoid and trapezium. So the floor of the snuff box is formed by number one. ये कौन है? Number one, styloid process of radius, the scaphoid and trapezium bone, right? who's the content of the snuff box? Content में क्या आता है? Radial artery. The content of snuff box is the radial artery, and who's lying in the roof? Roof में कौन होता है? Cephalic vein and the superficial branch of radial nerve. Cephalic vein and the superficial branch of radial nerve. So this becomes the anatomical snuff box. The boundaries, the contents, and the hello. हाँ बोलिए ना. हेलो. हाँ बोलिए बोलिए ना. सर मुझे थोड़ा सा क्या आप मूवमेंट कर रहे हो ना तो हिल रहा है तो ब्रेक हो रहा है. हाँ हाँ. बच्चे भी थे वो थोड़ा सा ब्रेक हो रहा है. वॉइस ब्रेक हो रहा है. ठीक है तो मैं अभी नहीं करता हूँ मूवमेंट ज्यादा. ठीक है. हाँ मूवमेंट थोड़ा एकदम एक्टिव रहेगा ना सर तो ठीक है ठीक है. ओके ओके ओके. सॉरी फॉर दैट. फाइन फाइन. ओके so what is this answer for this बच्चों? आंसर क्या होगा? what is the mark tendon? तो mark tendon क्या होगा? this tendon is extensor pollicis longus. Extensor pollicis longus. C for this. Answer is going to be C for this. C. ठीक है बच्चों. Answer is C for this. Clear to all of you? Any doubts? ठीक है बच्चों. Clear है? Any doubts in this? But I'm not able to see your comments, इसलिए ना it is taking some time. Okay, fine. चलो, we'll go to the next MCQ. Next MCQ. A patient present with hypothenar muscle wasting. Okay, hypothenar is this, है ना? Hypothenar muscle का wasting हो गया, ठीक है? And loss of sensations of the medial 1.5 digits. 1.5 digits के sensations are lost. Which nerve is involved? चलो बच्चों, can anyone tell me which nerve is involved? Any guesses? Which is the nerve which supplies the skin on 1.5 fingers and the muscles of the hypothenar eminence. Bolo bachcho, come on. What is this nerve? The nerve is ulnar nerve. Ulnar nerve. Ulnar nerve. Now tell me bachcha, who's going to supply the thenar eminence, the muscles of the thenar eminence? Medial nerve. तीन muscles of that thenar eminence में abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus. Abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and two lumbricals, number first and second. So 5 muscles supplied by medial nerve in the hand. Medial nerve supplies 5 muscles. How many muscles does the ulnar nerve supply? Just have a look at this. Ulnar nerve supplies 15 muscles in the hand. 15 muscles ulnar nerve supply करती है. यह है skin on the palmar aspect. यह है thenar eminence. ये क्या होगा? Hypothenar eminence. Right? Now, बच्चों, can anyone tell me who supplies the skin over the thenar eminence? Who supplies the skin over the thenar eminence? This is the palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve supplies the skin over the thenar eminence. Who supplies the skin over the hypothenar eminence? का नाम है palmar cutaneous branch of ulnar. Now you tell me, bachcho, this 3.5 fingers, skin, we are talking about skin. 3.5 fingers, skin को कौन supply करता है? Skin over 3.5 fingers, lateral 3.5 fingers is supplied by which nerve? Median nerve. and skin over the medial 1.5 fingers. Guesses this is the ulnar. Ulnar. So the answer for this is ulnar nerve. Medial nerve कितने muscles supply करता है? 5 muscles in the hand, and it supplies the skin on the lateral aspect of 3.5 fingers. Medial nerve, ulnar nerve. Hello, hello, hello. Voice is breaking. Ulnar nerve supplies how many muscles in the hand? Ulnar nerve supplies, okay. Ulnar nerve supplies 15 muscles in the hand, 15 muscles in the hand, and it supplies the skin on the medial aspect of 1.5 fingers. Skin on the medial aspect of 1.5 fingers that is supplied by. ठीक है बच्चों? The answer for this is going to be the ulnar nerve. Ulnar nerve. Can anyone tell me musculocutaneous nerve? Musculocutaneous nerve कितने muscle supply करता है बच्चों? Yes, any guesses? Musculocutaneous nerve supplies 3 muscles. One is biceps, biceps brachii, coracobrachialis, coracobrachialis, and brachialis. Biceps, coracobrachialis, and brachialis. ये कौन supply करता है? Musculocutaneous nerve. Ulnar nerve supplies 15 muscles in the hand. Radial nerve supplies 5 muscles in the hand. 5 muscles. Radial nerve कौन से aspect को supply करता है? The posterior aspect of the arm and forearm. This is supplied by the radial nerve. This is supplied by radial nerve. Okay, so answer is A for this. A. Okay, bachcho, coming to the next MCQ. Which of the following is the insertion of the pointed muscle? Come on, anyone answer this? Come on, bachcho, answer this MCQ. What is the muscle pointed? ये pointed muscle कौन है? Which is the muscle pointed? Any guesses? Hello, answer. Yes, answer is biceps, है ना? Answer for this is biceps. What is this muscle? Pointed muscle, biceps brachii. And where is the insertion of this pointed muscle? That's the radial tuberosity. मैंने अभी बोला था आपको biceps brachii का insertion is on the radial tuberosity. Medial malleolus कौन से bone का part है? Medial malleolus belongs to which bone? It belongs to the tibia. And medial malleolus belongs to the tibia, right? Olecranon process belongs to ulna. Olecranon process belongs to the ulna. The muscle attached to the olecranon process. Any guesses, bachcho? Muscle attached to the olecranon process. Come on, anyone answer? Yes, Dr. Nitin, very good. Khurshid, Rahul, Dr. Shri, Mukul. बोलिए बच्चों, what is attached to the olecranon process of ulna? ये मेरा सवाल है. What is attached to the olecranon process of ulna? Yes, triceps. Triceps is attached to the olecranon process of ulna. जो head of radius है, head of the radius, it fits into the radial notch of ulna, है ना? ये ulna में fit होता है. What is the name of the joint? Superior radio-ulnar joint. The head of the radius fits into the ulna, radial notch of ulna. Name of the joint है superior radio-ulnar joint. Type बोल सकते हो? Superior and inferior radio-ulnar joint. ये क्या type है? Anyone? Voice break हो रहा है. Okay. Just 1 minute. 1 moment. Give me 1 moment. वॉइस ब्रेक हो रहा है क्या अभी भी? वॉइस ब्रेक हो रहा है?
हाँ सर, वो हल्का हल्का मतलब आप ना यही बोलते हैं हल्का सा.
वो वॉइस को बढ़ा दो ना.
मैं बढ़ा ही देता हूँ.
ज्यादा बढ़ा दो. ओके, आई एम सॉरी, अभी वॉइस बढ़ा दिया है। हाँ बच्चों, अभी वॉइस इज इंक्रीज्ड। अभी देख लो। हेलो बच्चों, अभी वॉइस को बढ़ा दिया है। जस्ट हैव अ लुक एंड टेल मी। ओके, सो सुपीरियर एंड inferior radioulnar joint is a type of pivot. Yes, pivot type of synovial joint. Pivot type of synovial joint. The superior and inferior radioulnar joint is a pivot type of synovial joint, and middle radioulnar joint. Yes, very good, Dr. Shri. Very good. Middle radioulnar joint is an example of syndesmosis type of fibrous joint. Syndesmosis type of fibrous joint. Excellent. Very good. Very good to all of you. Very good. So superior and inferior radioulnar joint, pivot type of synovial joint, and middle radioulnar joint is a syndesmosis type of fibrous joint. ये बहुत इंपॉर्टेंट एमसीक्यू है बच्चों, बहुत इंपॉर्टेंट एमसीक्यू है, याद रखिए। ठीक है, वेरी गुड, वेरी गुड। वी कम टू द नेक्स्ट एमसीक्यू। एक मिनट, आई कैन सी समथिंग हियर। बच्चों हेलो हेलो, कैन एनीवन टेल मी व्हाट इज दिस प्रोसेस? ये क्या प्रोसेस है बच्चों? ये क्या प्रोसेस है? एनी गेसेस? What is that process? That's the coracoid process of scapula. कोई बोल सकते हैं what is the type of epiphysis? Coracoid process of scapula. What is the type of epiphysis? Anyone? Coracoid process of scapula. What is the type of epiphysis? बच्चों just try to be with me. बहुत सारे MCQs clear हो जाएंगे. What is the type of epiphysis? Yes, Dr. Shri, very good. Epiphysis का type बोलो। एपिफाइसिस चार टाइप्स के होते हैं: प्रेशर एपिफाइसिस, ट्रैक्शन एपिफाइसिस, atavistic एपिफाइसिस एंड aberrant एपिफाइसिस. So coracoid process of scapula is what type of epiphysis? Atavistic epiphysis. याद रखना, this is extremely important MCQ. Atavistic epiphysis. ठीक है बच्चों? Okay, very good, very good, very good to all of you. Now we go to the next MCQ. Identify the muscle in the diagram. Okay, identify the muscle in the diagram. Yes, any guesses? बोल सकते हो what is this muscle? Yes बच्चों, come on answer. ये कौन सा मसल है in this diagram? ये जो मसल है ना, वो स्कैपुला से अराइज होता है. इट बिगिंस फ्रॉम द स्कैपुला, राइट? इट बिगिंस फ्रॉम द स्कैपुला एंड इट इज अटैच्ड टू द ह्यूमरस. देखो, ये स्कैपुला से अराइज होता है एंड इट गोज इन फ्रंट एंड गेट्स अटैच्ड टू द medial lip of bicipital groove. Medial lip of bicipital groove. Very good. So this is teres major. Teres major. Excellent. Very good. Very good. You all are answering very well. Very well. मैं एक स्लाइड ड्रॉ करता हूँ. जस्ट लुक एट दिस. एक स्लाइड आई ड्रॉ फॉर यू. वेरी वेरी इंपॉर्टेंट स्लाइड. ये है स्कैपुला, दैट्स द acromion process. ये है यूट्रस. Fine. Now, can you identify this muscle which begins from the infraglenoid tubercle and goes and gets attached to the humerus? Goes and gets attached to the ulna. Sorry, goes to the ulna. ये है long head of triceps. Long head of triceps. ये क्या मसल है? Which begins from the lateral border of scapula. ये जो मसल है ना, it goes and gets attached to the greater tubercle. Greater tubercle. What is this muscle? ये है teres minor. Teres minor. And ये जो मसल है बच्चों, this muscle begins from the scapula and goes and gets inserted. ये आगे जा रहा है. देखो, आगे जा रहा है बच्चों. It is getting inserted on the medial lip of the bicep. What is this muscle? It is major. Excellent. Very good. तो बच्चों, can anyone tell me? अब देखो, ये teres minor है, ये teres major है. That's the long head of triceps, है ना? Long head of triceps. ये तीन मसल से we get spaces in the arm. बच्चों, can anyone tell me what is this space? ये क्या space है? Come on बच्चों, what is this space number 1? What is this space number 2? And what is this space number 3? Any guesses? Yes, any guesses? Number 1. Yes, number 1. Number 1 is the upper triangular space. Upper triangular space. अपर ट्रायंगुलर स्पेस के बाउंड्रीज क्या होंगे? टेरिस माइनर, टेरिस मेजर, लॉन्ग हेड ऑफ ट्राइसेप्स. सेकंड, नंबर सेकंड इज द लोअर triangular and number 3 is quadrangular space. Okay, number 1 upper triangular space, number 2 is the lower triangular space and number 3 is the quadrangular space. ठीक है बच्चों. अब कोई बोलेगा what is the content of the upper triangular space? ये एक आर्टरी होती है. What is the name of this artery here? Circumflex scapular artery. Very good Dr. Nitin, very good. What is the name of this artery जो नंबर 1 स्पेस से जाती है? That's the circumflex scapular artery. Very good. What's the name of structure passing through number 2? एक artery है, एक nerve है. What is this? The radial nerve and the profunda brachii artery. Radial nerve and profunda brachii artery. Very good, very good. Yes, very good Shubh Patil. And what is this number 3? Number 3 से कौन है? Contents बोलिए बच्चों, contents. नंबर 3 के कंटेंट्स बोलिए. नंबर 3 के कंटेंट्स बोलिए. यस, नंबर 3 इज एक्सिलरी नर्व एंड द पोस्टीरियर सर्कमफ्लेक्स ह्यूमरल आर्टरी. एक्सिलरी नर्व एंड द पोस्टीरियर सर्कमफ्लेक्स ह्यूमरल आर्टरी. ठीक है. तो अपर ट्रायंगुलर स्पेस के कंटेंट्स सर्कमफ्लेक्स स्कैपुलर आर्टरी. लोअर ट्रायंगुलर स्पेस के कंटेंट्स the radial nerve and the profunda brachii artery, and quadrangular space के contents is the axillary nerve and the posterior circumflex humeral artery. Perfect. देखो बहुत सारे MCQs होते हैं इसमें डिस्कस, है ना? Very good, very good, excellent, very good to all of you. चलो बच्चों, so let us go to the next MCQ. हाँ, अगले MCQ की तरफ चलते हैं. Yes, any guesses? Answer this. Upper lateral cutaneous nerve of arm is a branch of which nerve? Upper lateral cutaneous nerve of the arm is a branch of which nerve? Any guesses? बोल सकते हो? Upper lateral cutaneous nerve of the arm is a branch of. Axillary नहीं है बच्चा, axillary नहीं है. नहीं. शुभ? Anyone? Musculocutaneous. Shri, it's not axillary. Axillary nerve नहीं, it's musculocutaneous nerve. अब जो musculocutaneous nerve है ना बच्चों, musculocutaneous nerve, what does it supply? नहीं 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 बच्चा. Oh sorry, I'm so sorry. Upper lateral cutaneous nerve of the arm is a branch of axillary nerve. I'm so sorry. Okay, it's a branch of axillary nerve. Yes, Dr. Shri. It's a branch of axillary nerve. Upper lateral cutaneous nerve of arm. Yes, axillary nerve दो मसल सप्लाई करती है. Axillary nerve supplies a deltoid. It supplies the teres minor, and it gives a cutaneous branch that is upper lateral cutaneous nerve of arm. Upper lateral cutaneous nerve of arm. Right. I'm so sorry for this. So upper lateral cutaneous nerve of the arm is a branch of axillary nerve. And बच्चा अगर ये axillary nerve injury होती है, if there's an injury to the axillary nerve, there's a loss of sensations of the skin on the upper lateral aspect of the arm, and इसे क्या बोलते हैं हम? इसे हम बोलते हैं regimen batch sign. ये बहुत इंपॉर्टेंट एमसीक्यू है बच्चों. रेजिमेंट बैच साइन is seen in lesions of which nerve? Your answer is axillary nerve. Yes, very good Dr. Shri, very good. ठीक है बच्चा. शुभ क्लियर है? स्टडी लाइव, खुर्शीद, ऑल ऑफ यू आर क्लियर? मस्कुलोक्यूटेनियस नर्व का कॉन्टिन्यूएशन क्या है बच्चों? कैन एनीवन टेल मी व्हाट इज द कॉन्टिन्यूएशन ऑफ मस्कुलोक्यूटेनियस नर्व नोन एज? यस, कम ऑन, बोल सकते हो? व्हाट इज द कॉन्टिन्यूएशन ऑफ मस्कुलोक्यूटेनियस नर्व नोन एज? एनी गेसेस? वेरी गुड. बोलो बच्चा. मस्कुलोक्यूटेनियस नर्व का कॉन्टिन्यूएशन इज lateral cutaneous nerve of forearm. लैटरल क्यूटेनियस नर्व फोराम। ये जो लैटरल क्यूटेनियस नर्व फोराम है ना, ये किसकी कॉन्टिन्यूशन है? इट्स अ कॉन्टिन्यूशन ऑफ मस्कुलो क्यूटेनियस नर्व। लाइक मस्कुलो क्यूटेनियस नर्व अपने को पता है, इट सप्लाइज 3 मसल्स, एक बाइसेप्स हो गया, एक ब्रेकियालिस हो गया, एक कोराकोब्रेकियालिस हो गया, एंड देन इट कंटिन्यूज एज व्हाट? इट कंटिन्यूज एज द लैटरल क्यूटेनियस नर्व ऑफ फोराम। क्लियर बच्चों? Yes, lateral cutaneous nerve forearm. It's a continuation of musculocutaneous nerve. Perfect. Very good. Very good. Chalo. I'll proceed. Okay, going to the next MCQ. Radial artery ends as. Any guesses for this? Radial artery ends as. Answer this, bacha. Radial artery ends as deep palmar arch. Yes, radial artery ends as deep palmar arch. एक मिनट, I'll just draw this for you. It's deep palmar arch. हाँ, एक है ना, एक स्लाइड ड्रॉ करता हूँ मैं बच्चों. Just have a look at this slide. हाँ, इसमें ना कुछ MCQs है which are very important. Have a look at this. चलो, ये मैंने ऐसे ड्रॉ किया बच्चा. व्हाट इज दिस? दिस इज द फ्लेक्सर रेटिनाकुलम. फ्लेक्सर रेटिनाकुलम ये क्या है? एनीवन? ये क्या है? व्हाट इज दिस नोन एज? वोलर कार्पल लिगामेंट. ये है वोलर कार्पल लिगामेंट. ठीक है. अब ये टनल क्या है? गायोन्स टनल. गायोन्स टनल. That's a flexor retinaculum. ये है flexor retinaculum. ये उसका extension है. The extension of flexor retinaculum is the volar carpal ligament. And ये tunnel का नाम क्या है? Guyon's tunnel. बच्चों, can anyone tell me what is passing through the Guyon's tunnel? A very important MCQ for you. Very important MCQ for you. Structure passing through the Guyon's tunnel. बोलो बच्चों, come on. I'm waiting. I'm looking at the screen. बोलो. Structure passing through the Guyon's tunnel. Anyone? जो flexor retinaculum है उसका extension is known as volar carpal ligament. बीच में tunnel है is Guyon's tunnel. And what passes through the Guyon's tunnel? Excellent, Dr. Shri. Yes, very good, Dr. Nitin. Yes. एक है ulnar nerve and दूसरा है ulnar artery. Ulnar nerve and ulnar artery. Ulnar nerve and ulnar artery passes through the Guyon's tunnel. ठीक है. अब ये जो अल्नार आर्टरी है ना बच्चों, नाउ दिस अल्नार आर्टरी डिवाइड्स इनटू टू ब्रांचेस. लुक, दिस अल्नार आर्टरी डिवाइड्स इनटू अ सुपरफिशियल ब्रांच एंड अ डीप ब्रांच. ये सुपरफिशियल ब्रांच होगी. दिस इज द सुपरफिशियल ब्रांच ऑफ अल्नार आर्टरी and that's a deep branch of ulnar artery. Superficial branch and deep branch of ulnar artery. ठीक है. Okay, fine. The superficial branch of ulnar artery forms what? What is this? ये देखो. The superficial branch of ulnar artery forms, इसको हम बोलते हैं superficial palmar arch. Superficial palmar arch. Fine. Just wait. अब बोलो बच्चों, what is this artery? ये कौन सी artery है? That's the radial artery. है ना? Radial artery. The radial artery, that's the radial artery. The radial artery enters the hand through the snuff box. एक मिनट, ये मैं radial artery बना रहा हूँ. This is the radial artery. Snuff box में जाती है and snuff box से वो hand में जाती है. The radial artery gives a branch here. Name of this branch is the palmar cutaneous branch. Palmar cutaneous branch. Palmar cutaneous branch of radial artery. Now, the palmar cutaneous branch of radial artery completes what? The superficial palmar arch. मतलब बच्चों, you just have to know superficial palmar arch is formed by whom? It is formed by the superficial branch of ulnar artery. Superficial palmar arch is formed by the superficial branch of ulnar artery, and ये complete कौन करता है? It is completed by the superficial palmar branch of superficial palmar branch. Sorry, this is the superficial palmar branch of radial artery. superficial palmar branch of radial artery, ये complete करेगा. Now, what happens to the radial artery? The radial artery forms what? What is this arch? This arch is the deep palmar arch. एक मिनट, that's a deep palmar arch. So deep palmar arch is formed by which artery? Radial artery. And इसे complete कौन करेगा? Who's going to complete this arch? It is completed by the deep branch of ulnar artery. Deep branch of ulnar artery. मैं ना एक easy way देता हूँ. I'll give you one very easy way. एक मिनट. I'll just write this down for you. This is very important. Superficial palmar arch. ऐसे याद रखना इसको. Superficial palmar arch, and this is the deep palmar arch. Deep palmar arch formed by completed by. Formed by and completed by. So superficial palmar arch is formed by which artery? Superficial branch of ulnar artery. Superficial branch of ulnar artery क्या बनाती है? The superficial palmar arch, and this is completed by the superficial palmar branch of radial artery. Superficial palmar branch of radial artery. बस ऐसे याद रखना. The deep palmar arch is formed by whom? Radial artery. देखो arch है ना बच्चों, arch. To make an arch, you need two arteries. दो arteries चाहिए. एक होती है main artery. The second one is just going to complete the arch. So the superficial palmar arch is formed by which artery? The superficial branch of ulnar artery, and it is completed by what? The superficial palmar branch of radial artery. The deep palmar arch is formed by the radial artery, and it is completed by the deep branch of ulnar artery. It is completed by the deep branch of ulnar artery. Clear है बच्चों? Hello, is this clear to all of you? Just tell me. Clear नहीं है तो बोलो हाँ बच्चों. If it's not clear, you tell me. I'm not able to see your comments. I'll just see if I can see the comments anywhere else. Just one moment. Fine. Okay, fine. I'm not, now I'm able to see your comments. Okay, great. ठीक है बच्चों, clear to all of you? Yes, ये slide देख लो. So this number 1 is the superficial palmar arch, and number 2 is the deep palmar arch. So superficial palmar arch is formed by the superficial branch of ulnar artery, and it is completed by the superficial palmar branch of radial artery. Deep palmar arch is formed by the radial artery number C, and it is completed by the deep branch of ulnar artery. Hello. There's some problem with this voice. Still, I'm trying to talk loudly so that you can hear me. ठीक है? Dr. Nitin, थोड़ा सा refresh करिए. Anyone else is having this voice break issue? मतलब from my side? Snehajit, hello. Yes, Dr. Shri. Yes. Profunda brachii artery. Okay, fine. Now you let me know. Profunda brachii artery is a branch of which artery? बोल सकते हैं profunda brachii artery is a branch of. Any guesses? Okay, profunda brachii artery is a branch of brachial artery. It's a deep branch of brachial artery. Profunda brachii is a deep branch of brachial artery. Deep branch of brachial artery. ठीक है? Okay. चलो answer this बच्चों. Can anyone answer this? All are contents of cubital fossa except. चलो easy MCQ है बच्चों. Come on. All are contents of cubital fossa except. Anyone? Snehajit. Except brachial artery है बच्चा, brachial artery है. Ulnar nerve is not a content of cubital fossa. Ulnar nerve is not a content of cubital fossa. So which is the most medial content? सबसे medial is ulnar. सबसे medial is Snehajit. This is an FMG lecture. Just listen. Okay. सबसे medial कौन है? Median nerve followed by brachial artery with its two terminal branches. उसके दो terminal branches होते हैं, एक है radial artery and एक है ulnar artery. Both. So brachial artery along with the radial and ulnar artery, both are contents of cubital fossa. The third is tendon of biceps. And the fourth is radial nerve. Right? The fourth is radial nerve. So median nerve, brachial artery with its two terminal branches, the tendon of biceps and the radial nerve. But show ulnar nerve is not a content of cubital fossa. याद रखना. Ulnar nerve is not a content of cubital fossa. ठीक है? Okay. Clear to all of you? Can anyone tell me the boundaries of cubital fossa? Boundaries बोल सकते हैं cubital fossa के? Look at this. This is lateral. This is medial. Who's going to form the medial boundary? Pronator teres. Lateral boundary is formed by brachioradialis. Okay, that's fine. Brachioradialis. So lateral boundary is formed by brachioradialis. Medial boundary is formed by pronator teres. Floor किससे बनता है बच्चों? Can anyone tell me the floor of the cubital fossa is formed by which muscles? ये radius and ulna मैंने draw किया. The floor of cubital fossa is formed by, yes, anyone? Floor of cubital fossa is formed by two muscles. Anyone? एक मसल है जो अल्ना पे अटैच्ड है and एक मसल है which begins from the ulna and gets attached to the radius. What is this muscle? ये कौन सा मसल? चलो बच्चों, come on, answer. The floor of cubital fossa is formed by two muscles. I want the name of this muscles. Any guesses? एक है brachialis and दूसरा है supinator. One is brachialis and the other one is supinator. Clear to all of you? So boundaries of cubital fossa: medial is pronator teres, laterally is the brachioradialis. The floor is formed by the imaginary line. The base is formed by the imaginary line joining the two epicondyles. The floor is formed by the brachialis and the supinator muscle, and contents will be the median nerve, the brachial artery with radial and ulnar arteries, the tendon of biceps and the radial nerve. Clear to all of you? Okay, fine, perfect. Chalo bachcho, come on, answer this. Easy MCQ. Supination and pronation takes place at which of the following joints? Easy. Come on, easy MCQ. Pronation and supination कौन से joints पे होता है? अभी मैंने बोला, I've just told you this. The radio-ulnar joint. Radio-ulnar joint. Excellent. Very good. Radio-ulnar joint. What is the type of joint? It's a pivot type of synovial joint. Pivot type superior and inferior radio-ulnar joint. Pivot type middle radio-ulnar joint is syndesmosis. Medial radio-ulnar joint is syndesmosis. बच्चों, joints पे बहुत MCQs आते हैं joints पे. Wrist joint. What is the type of joint? Any guesses? Wrist joint. What is the type of joint? Wrist joint. चलो बोलो बच्चों. Yes, Dr. Nitin, Khurshid, Atul, Shri. Study live. हाँ बोलो. Wrist joint. What is the type of joint? Ellipsoidal. Very good. Very good. Ellipsoidal type of synovial joint. Excellent. Very good. Hey, hello. ये कौन से लैंग्वेज में आंसर कर रहे हो? Elbow joint. Elbow joint is what joint? Hinge joint. Hinge joint. Carpometacarpal joint. Chalo, come on, bachcho. Carpometacarpal joint. The first carpometacarpal joint is what type of joint? The first carpometacarpal joint is a saddle type of synovial joint. Saddle type. है ना? Elbow joint is a hinge joint. The first carpometacarpophalangeal joint, the first carpometacarpal joint is an example of a saddle type of synovial joint. Saddle type. Okay, clear to all of you? Fine. Coming to the next MCQ. Chalo. Post delivery, a patient complains of pain on the anterolateral aspect of the thigh. Which nerve is most likely damaged? See, even if you do not know the answer, options देखिए बच्चों, options. The one of the options is indicative of the answer. है ना? एक option है जो बहुत specify करते हैं, वही answer है. Sometimes answer is there in the options only. Even if sometimes you don't know, you can answer that. Yes, lateral cutaneous nerve thigh. Okay, lateral cutaneous. Very good. Answer is B. So, what is that condition known as? कोई बोल सकता है pain अगर lateral cutaneous nerve of the thigh compress हो गया, it supplies the skin on the anterolateral aspect of the thigh. The person will complain of paresthesia, tingling and numbness along the lateral aspect of the thigh. इसे क्या बोलते हो? What is this known as? Meralgia. Meralgia paresthesia. Meralgia paresthetica. ये भी बोलते हैं. Meralgia paresthetica. Okay. Femoral nerve is a nerve which compartment of the thigh? Anterior compartment. Anterior compartment of thigh की nerve कौन है? Femoral nerve. Yes, meralgia paresthetica. Yes, very good. Obturator nerve is a nerve which compartment बच्चा? Obturator nerve is a nerve medial compartment of the thigh. है ना? Obturator is a nerve medial compartment of thigh and tibial is a nerve which compartment? Yes, बोलो बच्चों. Tibial nerve is a nerve. Any guesses? Tibial. Tibial nerve is a nerve of the posterior compartment of the leg. Posterior compartment of the leg. है ना? Posterior compartment of leg का नाम क्या है? Tibial nerve. एक है superficial peroneal. ये भी खत्म करते हैं. Superficial peroneal. And one is deep peroneal. Superficial peroneal is a nerve which compartment? Lateral compartment of the leg. And deep peroneal is a nerve anterior compartment of the leg. ठीक है बच्चों? Is this clear to all of you? Okay. So anterior compartment of the thigh, femoral, medial compartment of the thigh, obturator, posterior compartment of the thigh is the tibial part of sciatic nerve. Tibial nerve नहीं है वो. It's the tibial part of sciatic nerve. Leg, posterior compartment, yes, tibial nerve. Lateral compartment, superficial peroneal nerve. Anterior compartment, that's the deep peroneal nerve. Deep peroneal nerve. Perfect. Be very clear about the nerves, huh, बच्चों? Meralgia paresthetica clear है, huh? Yes, very good. Under this, during examination, when a patient was asked to stand on the left foot, a drop on the right side was observed. Which muscles are paralyzed in this case? देखो बच्चों, just one moment. How do I explain you this? One moment. I'll just make this. Very good. Answer is B. Yes. Answer is B for this. Okay, just let me make this slide for you. That's a femur of one side. Huh? ये femur है. This is the hip bone. Huh? That's the hip bone. I've just made this as the hip bone. Just try to understand. अब बच्चों, suppose a person is standing on the right side. ये right side है. A person is standing on the right side. A person is standing on the right leg. Left leg उसने उठाया ऊपर. Left leg हवे में. The person is standing on the right leg. So the pelvis should fall on which side? The pelvis should fall on. Person is standing on right leg and the left leg is off the ground, so left side का pelvis गिरना चाहिए ना नीचे. Left side का pelvis गिरना चाहिए because left side का support नहीं है. Why? Because the gluteus medius and minimus of this side, of the right side के जो gluteus medius and minimus है, gluteus medius and minimus ये contract करते हैं and they pull the pelvis on this side. मतलब अगर पर्सन राइट साइड पे खड़ा है, राइट लेग पे खड़ा है, तो विच ग्लूटिया आर एक्टिंग राइट साइडेड ग्लूटियस मीडियस एंड मिनिमस, दे आर प्रिवेंटिंग द पेल्विस फ्रॉम फॉलिंग ऑन द लेफ्ट साइड. सेम साइड के ग्लूटियल मसल्स आर प्रिवेंटिंग द पेल्विस फ्रॉम फॉलिंग ऑन द अदर साइड. तो इफ अ पेशेंट इज स्टैंडिंग ऑन द लेफ्ट फुट पे पर्सन खड़ा है, तो कौन से ग्लूटिया आर एक्टिंग? लेफ्ट ग्लूटियस मीडियस एंड मिनिमस, एंड दिस लेफ्ट ग्लूटियस मीडियस एंड मिनिमस आर प्रिवेंटिंग द पेल्विस फ्रॉम फॉलिंग ऑन द राइट साइड. समझ में आ रहा है? अगर लेफ्ट ग्लूटियस मीडियस एंड मिनिमस पैरालाइज हो गए, इफ अ पर्सन इज स्टैंडिंग ऑन द लेफ्ट फुट and the left gluteus medius and minimus are paralyzed, the pelvis will fall on which side? Right side. So answer is left gluteus medius and minimus. समझ में आ रहा है ये बच्चों? समझ में आ रहा है? अगर क्लियर नहीं है तो बोलो. I'll explain it in a different way. हेलो बच्चों, समझ में आ रहा है? Abductor muscle weakness. Yes, Shubh. Yes, abductor muscle weakness. Very good. So gluteus medius and minimus are powerful abductors. ये सबको क्लियर है? ये मतलब if a person is standing on one side, that side muscles are going to prevent the pelvis from falling on the opposite side. Okay, very good. Chalo, excellent. Can anyone tell me the nerve supply of gluteus medius and minimus? Yes, बच्चों बोलो. Nerve supply of gluteus medius, gluteus minimus and tensor fascia lata. Answer this, a very important MCQ. ये तीनों का nerve supply बोलिए. Gluteus medius, minimus and tensor fascia lata. इसका nerve supply. Oh, that's great. Dr. Shri, very good. Huh? Your preparation is really good. Yes, excellent. That's the superior gluteal nerve. Bacha, this is a very important MCQ. Remember this, the superior gluteal nerve supplies three muscles, aka gluteus medius, gluteus minimus, and the tensor fascia lata. And what is the inferior gluteal nerve supply then? Inferior gluteal nerve, what does it supply? Any guesses? Very good. All of you are answering very well, huh, bachcho? All of you. Dr. Shri is also answering. The rest of you are also answering very well. Your preparation is really good. I'm really happy. Very good. What is the inferior gluteal nerve supply? Anyone? Inferior gluteal nerve. Bachcho. Inferior gluteal nerve supplies which muscle? Dr. Nitin, bolo bachcho. Shubh. Gluteus maximus. Very good. So inferior gluteal nerve क्या supply करता है? Gluteus maximus. Okay, and the main action of gluteus maximus क्या है? The main action of gluteus maximus is extension at the hip joint. दूसरा action abduction. तीसरा action is lateral rotation. So the main action of gluteus maximus is extension. Second is abduction. Third is lateral rotation. Just remember this. Okay, very good. Chalo, answer this, bachcho. Answer this. Which artery is being palpated? Which artery is being palpated? Answer this. Answer is posterior tibial artery. Posterior tibial artery. Yes, very good. Answer is posterior tibial. एक है ना, I'll just make this flow chart for you. बच्चों देखो, if you know this, you answer this. Popliteal artery है ना, popliteal artery के दो terminal branches होते हैं. Yes, very good, very good. Popliteal artery divides into anterior tibial and posterior tibial. हाँ, एंटीरियर टिबियल आर्टरी, पोस्टीरियर टिबियल आर्टरी. जो पोस्टीरियर टिबियल आर्टरी है ना, वो कौन से कंपार्टमेंट में जाती है? पोस्टीरियर कंपार्टमेंट ऑफ द लेग. पोस्टीरियर टिबियल आर्टरी है बच्चा, दैट गोज इन द पोस्टीरियर कंपार्टमेंट ऑफ द लेग. एंटीरियर टिबियल आर्टरी कहाँ जाती है? एंटीरियर टिबियल आर्टरी गोज टू द एंटीरियर कंपार्टमेंट ऑफ द लेग. एंटीरियर कंपार्टमेंट ऑफ द लेग. अब बच्चों, द पोस्टीरियर टिबियल आर्टरी गिव्स अ ब्रांच. Yes, इसका नाम बोलिए. And this artery goes to the lateral compartment. What is the name of this artery? Huh. Answer this. जो posterior tibial artery है ना बच्चा, that gives a branch, and this is the artery which goes in the lateral compartment of the leg. Can anyone tell me the name of this artery? नहीं, plantar नहीं है बच्चा, plantar नहीं है. Plantar नहीं है. Which is the bone on the lateral aspect in the leg? Fibula. Fibula कैसे दिखता है? पिन के जैसा दिखता है. Fibula looks like a pin. It is known as peronia. The name of the artery is peroneal artery. Peroneal artery. ठीक है बच्चों? So peroneal artery, ये MCQ है बच्चों, ये बहुत important MCQ है. Peroneal artery is a branch of. Peroneal artery is a branch of, your answer, posterior tibial artery. Posterior tibial artery. Anterior tibial artery continues as what? Anterior tibial artery continues as dorsalis pedis artery. Anterior tibial का continuation क्या है? Dorsalis pedis. Posterior tibial divides into two branches. Medial plantar and lateral plantar. Medial and lateral plantar. ठीक है बच्चों? Okay, very good. चलो, we go to the next MCQ. Same type of MCQ है. Same type of MCQ है. Name, what is the name of the marked artery? What is the name of the marked artery? Any guesses? Same है वो. Same है, like the one before. Answer is posterior tibial. It's the same artery. It's the same artery, posterior tibial. Which is this artery? This artery is anterior tibial. Yes, yes. Medial and lateral plantar are branches of posterior tibial. Medial and lateral plantar arteries are branches of posterior tibial artery. ठीक है बच्चों? Very good, very good. चलो. Answer this. What is true about the root value of femoral nerve? Yes, बच्चों. Can anyone answer this? What is the root value of femoral nerve? Yes. Posterior division of L2, L3, L4 ventral ramus. Okay, okay, very good, very good. Okay, answer is C for this. देखो बच्चों, कोई भी nerve, any nerve, how is it formed? By the ventral ramus. Ventral ramus. Okay, I'll just make you one very easy way. Ventral ramus, ventral rami of L2, L3, L4. Ventral ramus of L2, L3, L4 divides into a dorsal division and a ventral division. So the ventral rami of L2, L3, L4 divides into a dorsal division and ventral division. The dorsal division forms femoral nerve, and the ventral division forms obturator nerve. ठीक है बच्चों, easy. So ventral is also known as what? Anterior, and dorsal is also known as posterior division. Ventral का दूसरा नाम है anterior and dorsal का दूसरा नाम है posterior. So बच्चों, what is the root value of femoral nerve? Femoral nerve is formed by the dorsal divisions or the posterior divisions of the ventral rami of L2, 3, 4. And obturator nerve का root value क्या होगा? Obturator nerve is formed by the ventral divisions or the anterior division of the ventral rami of L2, 3, 4. Easy. Clear to all of you? Femoral and obturator में difference क्या है? Femoral nerve is formed by the dorsal divisions. Obturator nerve is formed by the ventral divisions. What is common? Ventral ramus. Ventral ramus is common in both. ठीक है बच्चों? That's a obturator nerve. Okay, I hope this is clear to all of you. Very good. Answer this, bachcho. First web space of the foot is supplied by. Come on, bachcho. Come on. That's a very, very important MCQ for you. Any guesses? Yes, deep peroneal nerve. Answer is deep peroneal nerve. Deep peroneal nerve. मैं एक slide draw करता हूँ बच्चों, देखो. This is a slide which I'm drawing. Have a look at this. Yeah, ना, that's a foot. ये foot draw किया मैंने. हाँ. That's a medial aspect. That's a lateral aspect. ठीक है बच्चों. अब बोलो, who supplies the skin on the medial aspect of the foot up to the great toe? Anyone? Who supplies the skin here? Cutaneous or cutaneous? Who supplies the skin on the medial aspect of the leg up to the great toe? बोलिए. Any guesses? ये बहुत इंपॉर्टेंट एमसीक्यू है. इसका नाम है saphenous nerve. The skin on the medial aspect of the leg up to the great toe. This is supplied by saphenous nerve. Medial aspect of great toe is supplied by superficial peroneal nerve. Medial aspect of great toe. Akshay, देखो, medial aspect of great toe is supplied by superficial peroneal. All the web spaces are supplied by superficial peroneal nerve. The first web space समझते हो ना बच्चों? where we put our slippers, जहाँ पे slippers पहनते हो, the first web space is supplied by deep peroneal nerve. First web space is supplied by deep peroneal nerve, and the lateral aspect of the foot is supplied by whom? Sural nerve. बस ये याद रखना. ये फुट है, फुट का नर्व सप्लाई है, क्यूटेनियस नर्व सप्लाई. Medial aspect of the foot up to the great toe, saphenous nerve. Medial aspect of the great toe is supplied by superficial peroneal. All the web spaces except the first one, superficial peroneal. The first web space is supplied by deep peroneal nerve. The lateral aspect of the foot is supplied by sural nerve. Sural nerve on the lateral side. Very good, बच्चा. Very good. Very good. अब है ना, ये सोल है बच्चा, ये सोल ऑफ द फुट है, सोल. हाँ, अभी देखो. The heel is supplied by whom? Heel is supplied by tibial nerve. Heel, sole, मतलब plantar aspect है, plantar aspect. The heel is supplied by tibial nerve. अब बच्चों देखो, 3.5 fingers is supplied by medial plantar nerve, and 1.5 fingers is supplied by lateral plantar nerve. 3.5 fingers on the medial side is supplied by medial plantar nerve. 1.5 fingers is supplied by the lateral plantar nerve. बच्चों, so medial plantar nerve resembles to which nerve of the upper limb? याद है अभी अपने hand पढ़ा था, hand who was supplying the skin on the lateral 3.5 fingers, कौन था ये? Which nerve was that? Lateral 3.5 fingers, who was supplying that? Medial nerve. So medial nerve corresponds to which nerve of the lower limb? Medial plantar nerve. And ulnar nerve किसे correspond करता है? Lateral plantar nerve. Medial plantar, lateral plantar भी बोलते हैं. शुभ, ठीक है, वेरी गुड वेरी गुड. चलो डॉक्टर नितिन, क्लियर, वेरी गुड. ठीक है बच्चों, वेरी वेरी गुड, यू आर ऑल आंसरिंग वेरी वेल. एक्सलेंट एक्सलेंट, सब बहुत अच्छा आंसर कर रहे हो. ओके, चलो बच्चों, आंसर दिस. All the following structure pass through the lesser sciatic foramen except all the structures pass through the lesser sciatic foramen except. Any guesses? बस एक याद रखना बच्चों, एक चीज याद रखना, ये याद रखिए, पिन, PIN, पिन. What is this P? ये निमोनिक याद रखना, PIN, पिन. What is P? P is pudendal nerve. P is pudendal nerve. ये है पिन, PIN, यही है पिन. P is pudendal nerve, I is internal pudendal vessels, and N is nerve to obturator internus. So these are the three structures which enter the lesser sciatic foramen. हाँ, ये lesser sciatic foramen के अंदर जाते हैं. Enter the lesser sciatic foramen. हाँ, and who leaves the lesser sciatic foramen बोल सकते हो? The structure which leaves the lesser sciatic foramen is the tendon of, बस ऐसे याद रखना बच्चों, tendon of obturator internus. The tendon of obturator internus. मतलब बच्चों, lesser sciatic foramen है, three structures are going in the lesser sciatic foramen and one structure is coming out through the lesser sciatic foramen. अब जो तीन structures हैं जो अंदर जा रहे हैं, which are going in, who are they? Pin, the pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. And who's coming out of the lesser sciatic foramen? Coming out is the tendon of obturator internus. Tendon of obturator internus बाहर आता है. So obturator externus is not related to to lesser sciatic foramen. समझ में आया बच्चों? Is this clear to all of you? Hello बच्चों, clear till here? Is it clear till here? एक मिनट, मैं टाइप पिक करता हूं. यस, शुभ, नितिन, बोलो बच्चा. अक्षय, और कौन है? स्टडी लीव. ओके, खुर्शीद, क्लियर है सबको बच्चों? ओके, गुड, वेरी गुड. चलो, yes. Now, which of the following muscle is attached to the arrow mark structure? Arrow mark structure दिख रहा है आपको? यो, that's the mark structure यहाँ पे. What is this mark structure? कोई बोल सकता है ये? What is this mark structure? Mark structure is lesser trochanter. वो है lesser trochanter. Lesser trochanter. Answer is iliopsoas. Very good बच्चों. Answer is iliopsoas. So marked structure is lesser trochanter. What is attached to the lesser trochanter is the iliopsoas. Okay, अभी देखो I'll tell you something. अभी you answer this. Great trochanter. Greater trochanter. Greater trochanter, lateral aspect, anterior aspect. चलो बोलो बच्चों बोलो, ग्रेटर ट्रोकेंटर पे लैटरल साइड पे कौन है, ग्रेटर ट्रोकेंटर के एंटीरियर साइड पे कौन है? एनी गेसेस? ग्रेटर ट्रोकेंटर के एंटीरियर साइड पे होता है ग्लूटियस मिनिमस एंड ग्रेटर ट्रोकेंटर के लैटरल साइड पे होता है ग्लूटियस मीडियस. बस ये याद रखना. That's a very, very, very important MCQ. Structure attached to the lateral aspect of the greater trochanter. Your answer is gluteus medius. Structure attached to the anterior aspect of greater trochanter. Your answer is gluteus minimus. And the third, if I tell you tip of the greater trochanter, ये बोल सकते हो? Muscle attached to the tip of the greater trochanter. Hello बच्चों बोलो. Muscle attached to the tip of the greater trochanter. Any guesses? Anyone? Muscle attached to the tip of the greater trochanter. Anyone? Piriformis. The muscle is piriformis. Perfect. Okay, we'll proceed. Great. Very good. We'll proceed. Chalo. Injury to the neck of the fibula. Which of the following nerve is injured? Answer this. Easy MCQ hai. Injury to the neck of the fibula. Which of the following nerve is usually injured? Any guesses? Hello students. Yes, Dr. Shri, Nitin. Dr. Nitin, bolo. किधर गए? I'm not able to see your comments. एक मिनट, I'm not able to see your comments. हाँ आया, अभी comments आया. Common peroneal nerve. Very good. Common peroneal nerve. Excellent. एक फ्लो चार्ट देता हूं मैं बच्चों, देखो. Sciatic nerve. एक फ्लो चार्ट देख लो. Sciatic nerve divides into a tibial nerve and a very good common peroneal nerve. Common peroneal nerve winds around the neck of the fibula. Common peroneal nerve divides into a superficial peroneal nerve and a deep peroneal nerve. Superficial peroneal nerve कौन से compartment of the leg में जाती है? Lateral compartment of the leg. Deep peroneal nerve goes to which compartment? Anterior compartment of the leg. And tibial nerve goes to which compartment? Posterior compartment of the leg. बस ये टेबल याद रखना बच्चों. मतलब जितने भी मसल्स है पोस्टीरियर कंपार्टमेंट ऑफ द लेग में, दिस इज सप्लाइड बाय व्हिच नर्व? टिबियल नर्व. द मसल्स इन द लैटरल कंपार्टमेंट ऑफ द लेग. लैटरल कंपार्टमेंट में कौन है? दो मसल्स है, पेरोनियस लॉन्गस एंड पेरोनियस ब्रेविस. तो हु इज गोइंग टू सप्लाई देम? द सुपरफिशियल पेरोनियल नर्व. And anterior compartment में which are the muscles? Tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. So who's going to supply them? The deep peroneal nerve. And if this deep peroneal nerve is injured, what do we get? A foot drop. Foot drop. We get a foot drop. Clear to all of you? Perfect. Should I proceed? Hello? Okay. Good. A needle is to be inserted by an intern for thoracocentesis. Which is the most preferred site for this clinical procedure? Any guesses? बोलो. If you have to do a pleural tapping, तो हम needle कहाँ पे insert करते हैं? This is one rib. ये देखो, this is one rib, and this is the second rib. So where do we insert the needle? Lower border of the upper rib. Very good. We always insert the needle here, along the lower border of upper rib. नहीं, एक मिनट. Sorry, नहीं, lower border of upper rib नहीं है. Lower border of upper rib नहीं है बच्चा. नहीं. Why lower border of upper rib? Answer is B. Answer is B. Upper border of lower rib. यहाँ पे insert करते हैं needle. Upper border of lower rib. Upper border of lower rib पे needle insert करते हैं. Why? Because lower border पे है ना, lower border पे there's something here. Lower border of the rib पे what is here? Costal groove. यहाँ पे होता है costal groove. And ये costal groove में structures होते हैं. बच्चों, how are the structures arranged in the costal groove? Any guesses? That's the intercostal vein, intercostal artery, and intercostal nerve. Sequence क्या है? Van. Sequence is van. Okay. Upper border of the lower rib. Yes, we always put the needle in the upper border. Upper border of the lower rib. मतलब ये number 5 rib है, ये number 6 rib है, suppose. So we put the needle in the upper border of the lower rib to prevent injury to this structures here. Right, because what is lying along the lower border of the upper rib, वहाँ पे costal groove होती है, and costal groove के अंदर क्या होता है? What is lying in the costal groove? Intercostal vein, artery, nerve. Vein, artery, nerve. They lie in the costal groove. So answer is upper border of the lower rib. Is this clear to all of you? Clear? Okay, fine. Very good. Answer this. A patient dissection. Injury to which of the following structures in the image will cause hiccups? Any guesses? What is this? B क्या है? Aorta. What is D? Is the left? Bronchus. What is A? A is the left. Common carotid. A is left common carotid. What is C? Phrenic nerve. C is phrenic nerve. Answer is C for this. C is phrenic nerve. But can anyone tell me what is the root value of phrenic nerve? Root value of phrenic nerve. Any guesses? What is the root value of phrenic nerve? C3, C4, C5. हाँ, ये याद रखना. This comes in MCQs. Root value of phrenic nerve is C3, C4, C5. The phrenic nerve lies on. Phrenic nerve lies on scalenus anterior muscle. दूसरा MCQ है. Phrenic nerve lies on which muscle? The scalenus anterior muscle. Scalenus anterior muscle. The right phrenic nerve goes along with IVC. The right phrenic nerve goes along with IVC. IVC है ना? IVC के साथ कौन जाता है? Right phrenic nerve. The left phrenic nerve pierces the diaphragm and enters in the abdomen. How does the right phrenic nerve go in the abdomen? It passes through the IVC opening in the diaphragm. What is the vertebral level? At T8. T8 vertebral level. Huh? So the right phrenic nerve goes along with the IVC, and what vertebral level is that? T8. It enters the abdomen. What happens to the left phrenic nerve? वो डायरेक्टली डायफ्राम को पियर्स करती है. ये याद रखना बच्चा, ये सब MCQs हैं. These are all MCQs. So how does the right phrenic nerve enter the abdomen? It passes through the IVC opening of the diaphragm, T8 level. The left phrenic nerve directly pierces the diaphragm and enters the abdomen. ठीक है? And it supplies the diaphragm from the abdominal aspect. तो ठीक है, फ्रेनिक नर्व का क्या पता है आपको? रूट वैल्यू C3, C4, C5. फ्रेनिक नर्व कौन से मसल पे लाई करता है? स्केलेनस एंटीरियर. द राइट फ्रेनिक नर्व गोज अलोंग विद द IVC. द लेफ्ट फ्रेनिक नर्व गोज डायरेक्टली पियर्सिंग द डायफ्राम इनटू द एब्डोमेन. परफेक्ट, वेरी गुड, वेरी गुड. एक और MCQ है. Both the phrenic nerve lies in front of the hilum of the lung. ये MCQ आता है. Both कैसे लिखो इसको? lie in front of hilum of the lung. तो ये कुछ पॉइंट्स है फ्रेनिक नर्व के बारे में. So who lies in front of the hilum of the lung? The phrenic nerve. Who lies behind the hilum of the lung? Vagus. Vagus. That's a very important MCQ, बच्चा. Behind the hilum, vagus. In front of the hilum, phrenic nerve. ठीक है? Very good. Answer this. Fossa ovalis is a remnant of. Answer this. Fossa ovalis is a remnant of septum primum. Septum primum. Very good. Very good. And septum secundum किसका remnant है? Limbus fossa ovalis is a remnant of septum secundum. Septum primum is this. ये fossa ovalis है, which is represented by septum primum, and इसके ऊपर there's a small elevation that is known as limbus fossa ovalis, which is represented by septum secundum. Septum secundum. ठीक है? Okay, good. Okay, fine. So easy MCQ. चलो answer this. The right coronary supplies all except. Any guesses? The right coronary artery supplies all except. Yes, answer this. हाँ अपेक्षा बोलो बच्चा. अपेक्षा. Right coronary artery supplies all except. Yes, Apeksha, what happened? Answer is anterior interventricular groove. Anterior interventricular groove. I'll just write this down for you. Right coronary, left coronary artery. What is the right coronary artery supply? It supplies the right atrium, right ventricle. Right atrium, right ventricle. Yes, बोलो बच्चों, और क्या सप्लाई करता है? The right coronary artery supplies the right atrium, right ventricle, SA node, AV node, left bundle of His, left bundle of His. इसको बोलते हैं left bundle branch. Left bundle of His is also known as left bundle branch. It supplies the posterior 1/3 of interventricular septum. It supplies the atrial septum, and it supplies the apex of the heart. Apex of the heart. Purkinje fibers, left bundle of his, left bundle of his. Okay. What is the left coronary supply? Left coronary supply is the left atrium, left ventricle, left and right bundle of his. It supplies the anterior 2/3 of interventricular septum. It supplies the apex of the heart. Apex of the heart. So, bachcho, apex of the heart is supplied by what? If that's an MCQ, apex of the heart is supplied by, what is your answer? Apex of the heart is supplied by right coronary also. It is supplied by the left coronary also. So apex of the heart is supplied by both the coronaries. Both the coronaries. Yaad rakhna. It is supplied by both right and left coronaries. Okay. Fine. Clear. So answer here is anterior interventricular. Anterior interventricular group. Fine. Chalo. Answer this. Which is true about bronchopulmonary segments? Can anyone tell me this? Bronchopulmonary segments. Answer this, bachcho. What is true about the bronchopulmonary segments? Hello, hello. I can't see your comments. Ek minute. Any guesses? Hello, bachcho. Yes, Dr. Shri, Apeksha, Nishri, Dr. Nitin, कहाँ गए? Zenith, Shubh, Prashansu. Okay, what is the answer for this? Which of the following about bronchopulmonary segments is true? Yes. Non-resectable, wrong. No, it can be resected. Bronchopulmonary segment can be resected. Spherical in shape? No. It is wedge shaped. Wedge. It's a wedge shaped. Arteries intersegment? Wrong. What is the answer? The veins are intersegmental. Veins are intersegmental. I'll tell you this. हाँ ये मैं बोलता हूँ देखिए. That's a right lung. That's an anterior border. That's a left lung. Anterior border. That's a cardiac notch. This is lincula. Lung like this. That's a lincula. That's a left lung. What is this fissure? That's the oblique fissure. है ना? ये है oblique fissure. What is this fissure? Horizontal fissure. So what is this lobe? Upper lobe. ये है middle lobe. ये है lower lobe. ये है upper lobe. ये है lower lobe. Okay. Now coming to the bronchopulmonary segment. अब what is a bronchopulmonary segment? Bronchopulmonary segment वो होता है. It's a part of the lung which is supplied by one tertiary bronchus. Bronchopulmonary segment is a part of the lung supplied by one tertiary bronchus. ठीक है? Part of the lung supplied by one tertiary bronchus. अब देखिए bronchopulmonary segments of the left lung upper lobe. ये पता है ना आपको? Left lung upper lobe के bronchopulmonary segments कितने होते हैं? This is apical, this is anterior, and that's posterior. For the middle lobe, this is medial, and that's lateral. For the lower lobe, what are the bronchopulmonary segments of the lower lobe? Apical. This is lateral basal. This is anterior basal. This is lateral basal. This is posterior basal. And एक होता है medial basal. medial basal. Okay. So how many bronchopulmonary segments? 10 for the right lung. Upper lobe के 3 bronchopulmonary segments, apical, anterior, posterior. Middle lobe के 2 bronchopulmonary segments, medial and lateral. The lower lobe has got 5 bronchopulmonary segments, apical, anterior basal, lateral basal, posterior basal, and medial basal. That's on the medial side. For the left lung, bronchopulmonary segments are something similar. This is apical, anterior, posterior. This is what we call as the superior, lingular, inferior, lingular. बाकी same है. This is apical, anterior basal, lateral basal, posterior basal, and there is no medial basal segment. A medial basal segment is absent in the left lung. So how many bronchopulmonary segments for the left lung? 9. And how many bronchopulmonary segments for the right lung? 10. 10 for the right lung, 9 for the left lung. Clear, bachon? Is this clear to all of you? Who lies between the segments? Who lies between the segments? Between the bronchopulmonary segment lies the pulmonary veins. The veins that lie between the bronchopulmonary segments, the veins are said to be intersegmental. Intersegmental. Veins are intersegmental. ये याद रखना बच्चों. Veins are intersegmental. अच्छा, voice is breaking. Hello. Voice is breaking. Hello. Is this clear? Hello. See, if I talk like this, is it clear? Hello, is it clear? If I talk like this? Hello. Hello. Okay, fine. So see here, look here once again. अपर लोब के ब्रोंकोपल्मोनरी सेगमेंट्स कितने हैं? 3. हाँ, अपाइकल, एंटीरियर, पोस्टीरियर. मिडिल लोब के ब्रोंकोपल्मोनरी सेगमेंट्स आर 2, मीडियल एंड लैटरल. लोअर लोब के ब्रोंकोपल्मोनरी सेगमेंट्स आर 5, अपाइकल, एंटीरियर बेसल, लैटरल बेसल, पोस्टीरियर बेसल है. ये सब बेसल सेगमेंट्स हैं. Anterior basal, lateral basal, posterior basal, and medial basal. So how many bronchopulmonary segments for the right lung? 10. For the left lung, apical, anterior, posterior, superior lingular, inferior lingular. Lower lobe, apical, anterior basal, lateral basal, posterior basal, and no medial basal. Medial basal segment is absent in the left lung. So left lung के bronchopulmonary segments are how many? 9. And right lung, it's 10. Clear? Now, who runs between the bronchopulmonary segments? Who lies between the bronchopulmonary segments? The pulmonary veins. Pulmonary veins. Just remember, each bronchopulmonary segment has its own artery, and tertiary bronchus. Each bronchopulmonary segment has its own artery and tertiary bronchus. The veins do not belong to one particular segment. The veins are said to be intersegmental. Okay, veins are intersegmental. So I hope this is clear to all of you. So it is shaped, it is resectable. Artery is not intersegmental. Who's intersegmental? The pulmonary veins. Perfect. Okay, answer this. A person met with a road traffic accident. Hello. Now also the voice is not clear. Hello. अभी देखो बच्चों, is the voice clear now? Is the voice clear now? A person met with a road traffic accident and suffered from injury to the membranous urethra. Okay, fine. A person met with a road traffic accident and suffered from injury to the membranous urethra. Okay, fine. Which will be the location of collection of urine due to this injury? Answer this. Yes, what is the answer for this? हाँ, बोलो बच्चों, come on. Any guesses? Any guesses for this? And I can't see the comments. Comments नहीं दिखते मुझे, थोड़ा सा प्रॉब्लम है. Yes. See, urine है ना, urine will collect in the superficial perineal pouch. Urine will also collect, answer is superficial perineal pouch. Urine will collect in the anterior abdominal wall in the space. हाँ, एक space है जिसका नाम है superficial inguinal space. Anterior abdominal wall में collect नहीं होता है. Urine does not collect in the anterior abdominal wall. The urine collects in the space in the anterior abdominal wall, which is known as the superficial inguinal space, which lies between. It lies between Scarpa's fascia and external oblique aponeurosis. So ये anterior abdominal wall is wrong. Where does it collect in the anterior abdominal wall? It collects in a space जिसका नाम है superficial inguinal space, and this space lies between the Scarpa's fascia and the external oblique aponeurosis. हाँ बच्चा, wait, I'll tell you. हाँ Shri, I'll tell you. एक मिनट, हाँ, I'll draw one slide बच्चा. I'll draw one slide. देखो. Okay, बच्चों, tell me what is this? That's the bladder, that's the urethra, that's the prostate, and what is this? ये क्या होता है? देखो, what is this? ये जो membrane है ना, this is one. I'll just draw this for you. हाँ, मैं ये draw करता हूँ बच्चा. And so I'll just put this number 1. I'll put this as number 2. I'll put this as number 3. Huh? Okay, just one moment. I'll put this as number 4. I'll put this as number 5. I'll put this as number 6, number 7, number 8. चलो, अभी बोल सकते हो बच्चों? What is number 1? एक मिनट, just let me write it down. Number 1. Number 1 क्या है बच्चों? Can anyone tell me what is this number 1? Number 1 is the superior layer. Superior layer of urogenital diaphragm. Number 2 is the inferior layer of urogenital diaphragm. Urogenital diaphragm is a membrane, ना? एक होता है superior layer of urogenital diaphragm, एक होता है inferior layer of urogenital diaphragm, and number 3 is known as the superficial perineal pouch. मतलब where is, I'm so sorry, that's a deep perineal pouch. Number 3 is the deep perineal pouch. Where is the deep perineal pouch lying? The deep perineal pouch is lying between the superior layer of urogenital diaphragm and the inferior layer of urogenital diaphragm. इनके बीच में जो pouch होता है, that's a deep perineal pouch. Number 4 is the Colles fascia. Colles fascia is the fascia which lines the scrotum, which lines the labia majora, है ना? ये Colles fascia. Number 5 is the superficial perineal pouch. Huh? Number 5 is the superficial perineal pouch. Number 6 is the external oblique aponeurosis. Number 7, I'm so sorry. Number 7 is the Scarpa's fascia. And number 8 is superficial inguinal space. Number 8 is superficial inguinal space. Huh? I'll tell you this. I'll tell you just 1 minute. Now, what is this number 9? Number 9. Oh, what has happened here? Oh, 1 minute. Fine. What is this number 9? Number 10. Number 11. Number 9 is prostatic urethra. Number 10 is membranous urethra. And number 11 is penile urethra. एक मिनट, what was the question there? Oh, membranous urethra. Okay, वो थोड़ा गलत है, गलत क्वेश्चन है, ठीक है. ठीक है बच्चों, अब ये क्लियर है. So now is this clear? What I have drawn is the superficial and deep perineal pouches for you. So where is the deep perineal pouch lying? The deep perineal pouch is lying between the superior and inferior layer of urogeneal diaphragm. The superficial perineal pouch lies between the inferior layer of urogeneal diaphragm and the Colles fascia. The urethra in the prostrate is known as the prostatic urethra. In the deep perineal pouch is known as the membranous urethra. And in the superficial perineal pouch is known as the penile urethra or the spongy urethra. Penile urethra का दूसरा नाम है spongy urethra. Clear है? Clear till here? If it's clear till here, you tell me, then I proceed. Okay, now you tell me, what is this urethra inside the prostrate known as prostatic urethra? The urethra in the deep perineal pouch, ये ना number, what is this? I'll just color this for you. What is this pouch here? What is this pouch? That's the deep perineal pouch. The urethra present in the deep perineal pouch is known as the membranous urethra. And what is this pouch? बच्चों, एक मिनट, what is this space? Okay, what is this space? That's the superficial perineal pouch. And this superficial perineal pouch is continuous with the scrotum. See, it is continuous with the scrotum, it is continuous with the penis, and it is continuous in the space which is known as the superficial inguinal space, which lies between the Scarpa's fascia number 7 and number 6 is the external oblique aponeurosis. So that's the superficial perineal pouch, right? Now, if there's an injury to the urethra in the deep perineal pouch, have a look at this. अगर यहाँ पे injury होता है deep perineal pouch में, the urine remains only in this pouch. Urine cannot go outside this pouch. तो है ना, वो क्वेश्चन थोड़ा सा गलत है. If there's an injury to the membranous urethra, the urine will remain in the deep perineal pouch. The option should have been deep perineal pouch. हाँ, उससे बाहर नहीं जाएगा. But if the urethra is ruptured here in the superficial perineal pouch, अगर injury होता है, the urine will collect in the scrotum. Look at this. The urine will collect in the scrotum. The urine will collect in the penis, and the urine will enter the space which is known as the superficial inguinal space. The urine will enter the superficial inguinal space. The urine goes as high as the chest. Fine. Okay, so if there's a injury to the membranous urethra, see, there's an injury to the membranous urethra, where will the location of collection of urine due to this injury be? So what is your answer? Answer is not A. Answer A नहीं है. Answer is not A in this case. Where will the collection of urine be? The collection will be in the deep perineal pouch. वेरी गुड वेरी गुड. अब समझ में आया. बिकॉज मेम्ब्रेनस यूरेथ्रा होता कहाँ पे है बच्चों? मेम्ब्रेनस यूरेथ्रा डीप पाउच में होता है. एंड इफ देयर इज एन इंजरी टू द मेम्ब्रेनस यूरेथ्रा, द यूरिन विल रिमेन ओनली इन द डीप पाउच. याद रखना. तो है ना, ये द ऑप्शन शुड हैव बीन मॉडिफाइड. वन ऑप्शन शुड हैव बीन डीप पेरिनियल पाउच. सो ये है ना, एक ऑप्शन डीप पेरिनियल पाउच लेके उसको करेक्ट करो. And if the penile urethra is ruptured, where is the penile urethra? In the superficial perineal pouch. अगर penile urethra rupture होता है, the urine will collect in the scrotum, the urine will collect in the penis, and the urine will collect in the anterior abdominal wall in that space which is known as the superficial inguinal space. Clear? Clear, Amisha, Apeksha, clear है? Clear, Dr. Nitin? सबको क्लियर है बच्चों? प्रांशु, जेनित, दादा शुभ, कहाँ हो? फाइन. सो मेक दिस एज द डीप पेरिनियल पाउच. एक ऑप्शन डीप पेरिनियल पाउच ले लो. ओके, वेरी गुड वेरी गुड. चलो आंसर दिस. इन गिवन इमेज व्हिच लैंडमार्क कैरीज स्प्लेनिक वेसल्स? वेरी गुड बच्चा, वेरी गुड. ओके. In the given image, which landmark carries splenic vessels? Anyone? Can anyone tell me this? Answer is splenic vessels. Now B is, what is B? What is B? But B है क्या? Lino-renal ligament है ना. B is lino-renal ligament. ठीक है. B is lino-renal. Yes, yes. What is C? C क्या है? C क्या है बच्चा? I'm not able to see that clearly. What is C? C कौन है बोलो? C. Where is C? What is C? C is lesser sac. वो stomach के पीछे एक sac होता है. There's a sac behind the stomach which is known as the lesser sac. C gastrosplenic है. अच्छा, C is gastrosplenic. Sorry. C is gastrosplenic. Sorry. Oh, I couldn't see that clearly. C is gastrosplenic. Okay. What is D? Yeah, gastrosplenic ligament में क्या होता है? Short gastric vessels and yes, short gastric vessels. And the left gastroepiploic vessels. Short gastric vessels and the left gastroepiploic vessels. Gastrosplenic ligament. This is lesser sac. ये देखो बच्चों, this cavity behind the stomach is the lesser sac. Okay, that cavity behind the stomach is lesser sac. Fine, clear to all of you? We'll take a break for 5 minutes. 5 minutes का break ले लो. Then we'll again resume. And just take a break of 5 minutes. Okay, hello. Welcome back. Okay, so A is gastrosplenic. Yes, Shri. Sorry, I couldn't see that properly in that image. So A is gastrosplenic, B is lenorenal ligament, C is lesser omentum. That's less omentum. That's the space that's between the liver and the stomach. That's less omentum. C is left gastric. Left gastric. Why do you feel it? Left gastric is fine. Left gastric is present within the less omentum. Artery देखी क्या इसमें? So within the less omentum, there's an anastomosis between the left and the right gastric artery. That's fine. And D is that three structures: hepatic artery, portal vein, and bile duct. है ना? ठीक है. Okay, very good. Very good to all of you. I'll continue. Yes. Thank you, Shri. Thank you. Fine. So who carries splenic vessels? That's a linorenal ligament. What else is present along with the splenic vessels? Can anyone tell me? In the linorenal ligament, number 1 is the splenic vessel. Number 2. Yes, very good, Shri. Number 2 is what? Tail of pancreas. Remember, the linorenal ligament contains the splenic vessels and the tail of pancreas. And bacho, the maximum islets are present in the tail of pancreas. So while removing the spleen, while doing splenectomy, we have to be very careful when we cut the linorenal ligament, because the tail of the pancreas would get damaged. And if the tail of the pancreas is damaged, the person would land into diabetes mellitus. Okay, so tail of the pancreas contains the maximum islets of Langerhans. And which part of the pancreas is more prone to cancer? Can anyone tell me? Which part of the pancreas is more prone to cancerous changes? Any guesses? क्वेश्चन नंबर 24 बाकी है. एक मिनट. Which part of the pancreas is more prone to cancerous changes? Head of the pancreas is more prone to cancer, and tail of the pancreas contains the maximum islets of Langerhans. Remember, question number 24. क्या था क्वेश्चन बच्चा? What was the question? 24. I'm not able to get this. Okay, fine. ठीक है, fine. See the next. Okay, we start. Which of the following structure is derived from umbilical artery? Any guesses, बच्चों? Which of the following structure is derived from the umbilical artery? Any guesses? Okay. Medial umbilical ligament. Yes, medial umbilical ligament. Now, I'll tell you something very important, Pacho. I'll tell you something very, very important. Okay, look at this. Tell me, what are the contents of the umbilical cord? I mean, what is the constituents of the umbilical cord? What is present in the umbilical cord? There are 2 umbilical arteries and left and 1 umbilical vein. 2 umbilical arteries and 1 umbilical vein. That's a left umbilical vein, right? So two umbilical arteries, and this is the left umbilical vein. The umbilical vein is carrying pure blood, so it is red in color. Now this left umbilical vein goes and joins with what? Have a look at this. This left umbilical vein goes and joins with, who's this? That's the liver. And there's a big vein in the liver. What's this vein in the liver? That's the portal vein. That's a portal vein. So the left umbilical vein goes and joins with the left branch of portal vein. Okay. So this is the left umbilical vein. Okay, that's the left umbilical vein. It goes and joins with, that's the left branch of portal vein. Okay, don't write anything. That's the left branch of portal vein. Now this is carrying pure blood, right? Left umbilical vein is carrying pure blood. If it goes in the portal vein, from the portal vein, the blood will go to the liver. अब liver will use all this pure blood for its own metabolism. Liver will use all this pure blood. So the blood should not go to the liver, correct? So there's a big bypass here. ये कौन है? IVC. And there's a bypass from the portal vein to the IVC. Can anyone tell me what is this bypass known as? Ductus venosus. That's the ductus venosus. ठीक है. Now, from the IVC, the blood goes where? To the right atrium. Right atrium? Right atrium says the blood directly goes to the left atrium through, what is this? Foramen ovale. Just understand this. समझ में आ जाएगा सब. Just wait, listen to me. So, I'm telling you the fetal circulation, right? So, contents of umbilical cord, two umbilical arteries and the left umbilical vein. Left umbilical vein carries blood from the placenta. It goes and joins with the left branch of portal vein. Left branch of portal vein से ductus venosus होती है. It takes blood to the IVC. IVC से the blood goes to the right atrium. Right atrium से directly left atrium through the foramen ovale. Left atrium से the blood goes to the left ventricle. Left ventricle से aorta. Aorta divides into two common iliac. Common iliac divides into two common iliac. I'm writing here common iliac. Common iliac divides into external and internal iliac. Internal iliac and external iliac. And from the internal iliac, there are two arteries. There are two arteries which are coming towards the umbilicus. What are these arteries? Umbilical artery. So umbilical artery कहाँ से arise होते हैं? Umbilical artery begins from the internal iliac. From two internal iliac, two umbilical arteries begin and they go up towards the umbilicus. When they are going towards the umbilicus, on the way comes the urinary bladder. ये urinary bladder. That's a urinary bladder. So this is the fetal circulation. But this is the fetal circulation. Suppose blood from the right atrium, suppose अगर राइट वेंट्रिकल में गया, राइट वेंट्रिकल से ये जाएगा पल्मोनरी ट्रंक में, है ना? इट विल गो टू द पल्मोनरी ट्रंक and from the pulmonary trunk it will go to the lungs, but the lungs are not functioning, correct? The lungs are not functioning, so the blood should not go to the lungs. There's a bypass here from the pulmonary trunk to the aorta, and this bypass is known as the ductus arteriosus. Ductus arteriosus. What is this, bachcho? This is the fetal circulation. This is fetal circulation. Once again, I'll tell you. See, from the placenta, the pure blood goes to the left branch of portal vein through the left umbilical vein. From the left branch of portal vein through the ductus venosus to the IVC. IVC से right atrium. Right atrium से directly left atrium. Left atrium से left ventricle. Aorta. Aorta divides into common iliacs. फिर internal iliac, and internal iliac से the umbilical arteries will carry the blood back to the umbilicus. On the way comes the bladder. एक ये side से जाएगा, एक ये side से जाएगा. On either sides of the bladder. Suppose from the right atrium, the blood goes to the right ventricle. From the right ventricle, it would go to the pulmonary trunk, but the lungs are not functioning, so the blood will directly again go to the aorta. This bypass is known as the ductus arteriosus. After birth. अभी after birth क्या होता है? After birth, this part is gone. The left umbilical vein, what does it form after birth? अभी बोलो बच्चों, अभी बोलो, आंसर करिए. Answer now. What happens to the left umbilical vein after birth? It becomes the ligamentum teres. These are very important MCQs, bachcho. These are very important MCQs. The left umbilical vein after birth becomes a ligamentum teres. Ductus venosus after birth becomes ligamentum venosum. Okay, ligamentum venosum. Foramen ovale after birth becomes the fossa ovalis. Fossa ovalis. Ductus arteriosus after birth becomes the ligamentum arteriosum. Okay, ligamentum arteriosum. अब this part of the umbilical artery from the bladder to the umbilicus obliterates off. इतना part of umbilical artery obliterates off. This is what we call as the obliterated umbilical artery. After birth, इसे हम बोलते हैं the medial umbilical ligament. So that's the obliterated umbilical artery, which becomes a medial umbilical ligament. And this part is the non-obliterated part of umbilical artery. समझ में आ रहा है? This is the non-obliterated part of umbilical artery. It would begin from the internal iliac. It would supply the bladder. This is now known as the superior vesical artery. The superior vesical artery is the non-obliterated part of umbilical artery, and the obliterated part of umbilical artery is known as the medial umbilical ligament. Is this clear? Is this clear to all of you? Okay, great. Very nice. Chalo, good. Sorry, वो dear आया. Fine. Clear to all of you, बच्चा? Yes, very good. So ये सब remnants याद रखना. ये सब remnants are MCQs for you. Okay. So obliterated left umbilical vein becomes ligamentum teres. The team will get back to you, huh? So Shobi, the team will get back to you. ठीक है? So obliterated left umbilical vein, ligamentum teres. Ductus venosus becomes ligamentum venosum. Foramen ovale का बन गया fossa ovalis. Ligamentum arteriosum is a remnant of ductus arteriosus. Obliterated umbilical artery is the medial medial umbilical ligament, and the non-obliterated part of umbilical artery becomes the superior vesical artery. Perfect. This should be perfect. Okay. Answer this better. Rotation of midgut occurs around. Yes, बोलिए बच्चों. Yeah, ना. Look, the liver is growing very, very fast on the right side. The liver is growing very fast on the right side. So there's no place for the intestine inside the abdomen. Intestine को जगह नहीं है abdomen के अंदर. अब ये intestine क्या करेगा? The intestine forms a loop, and ये loop umbilicus से बाहर आता है. Okay, and जब ये loop बाहर आता है, who comes with the loop? The superior mesenteric artery. The superior mesenteric artery. Very good. So this is a loop of midgut like this. This is a loop of midgut, and who comes with here? That's the superior mesenteric artery. The superior mesenteric artery comes along with the midgut loop. Okay, because it is going to supply the midgut. This is known as a hernia, and this hernia is going to come back. ये वापस आएगा abdomen के अंदर. So this is what we call as a physiological hernia. Physiological hernia. So when does the herniation begin? 6 weeks. That's a MCQ. हाँ, ये याद रखना. Herniation of midgut. Herniation of midgut occurs at 6 weeks. Okay, and reduces by 10 week. Okay, so why does the midgut loop come out of the abdomen? Because the liver is growing very fast on the right side, and because the liver is growing very fast, there's no place for the midgut, so the midgut comes out of the umbilicus. इसे हम बोलेंगे physiological hernia. And when does this occur? By 6 weeks of intrauterine life. 6 weeks of intrauterine life. And this midgut ka loop will rotate around the superior mesenteric artery. It rotates. And finally, it returns back to the abdomen. And when does it return back? By 10th week. 10th week. Ye yaad rakhna bacha. That's a very important MCQ. Fine hai? What is the vertebral level of superior mesenteric artery? Can anyone tell me? Vertebral level of superior mesenteric artery. Yes. What is the origin? Vertebral level of origin of superior mesenteric artery. Anyone? Bolo bacho, I'm looking at the screen. Bolo. Vertebral level of origin of superior mesenteric artery is L1. And vertebral level of origin of inferior mesenteric artery is L3. Okay, so superior mesenteric artery arises at L1 vertebral level, inferior mesenteric artery arises at L3 vertebral level. Okay, got this. Okay, clear, fine. Chalo. Answer this. Trigone of urinary bladder develops from. Can anyone answer this? Trigone of urinary bladder develops from. Trigone of urinary bladder develops from. Yes, boliye. Mesoderm. Mesoderm. Very good. The rest of the bladder is derived from what? Yes, Nitin. Yes, Shri. Baki pura bladder is derived from what? The trigone of the bladder is derived from mesoderm, right? But the rest of the bladder is derived from what? Any idea? The rest of the bladder is derived from endoderm. Endoderm. So the bladder is developed from endoderm except trigone, which is derived from mesoderm. ये याद रखना. ये याद रखना. ठीक है. That's a very important MCQ. Okay, fine. Answer this. Testicular artery is a branch of. Testicular artery is a branch of. Okay, I'll just tell you one very important thing to remember. See, एक मिनट. Understand this. Abdominal aorta. उसके branches होते हैं 2, 3, 4, 5. बस ये याद रखना. So many of the MCQs will be clear to all of you. So two terminal branches. 2 terminal branches at L4. Aorta divided at what vertebral level? L4. And what are these 2 terminal branches? ये कौन होता है? Common iliacs. 2 terminal branches are common iliacs. है ना? ये कौन है? Terminal branches are what? Common iliacs. 3. What is 3? Anyone? 3 ventral branches. 3 ventral branch. 3 ventral branch में which is the first one? बच्चों, first one. A. Celiac trunk. What is vertebral level? L12. Second, superior mesenteric artery. L1. Inferior mesenteric artery. L3. Okay, उसके बाद 4 lateral branches. 4 lateral branches. उसमें first is inferior phrenic. Lateral branches will be in pairs, है ना? Sides पे होंगे ना for paired organs. inferior phrenic, middle suprarenal, renal, and the last one is gonadal. Gonadal mein it would be testicular or ovarian. Testicular or ovarian, so it is gonadal. And last is five dorsal branches is named 4 pairs of lumbar arteries, 1 median sacral artery. 4 pairs of lumbar arteries and 1 median sacral artery. That's how you remember this. So this is the entire flow chart of abdominal aorta for you, bacho. And there are plenty of MCQs in this. Plenty of MCQs. So 2 terminal branches at L4, that's common iliac. 3 ventral branches, celiac trunk, superior mesenteric, inferior mesenteric. In case vertebral levels are very important. 4 lateral branches. Lateral branches would be for paired organs. So pehla is inferior phrenic, second is middle suprarenal, third is renal, fourth is gonadal. 5 dorsal branches, जिसमें 4 pairs of lumbar arteries and 1 median sacral artery. Perfect. Okay, I'll proceed. So what is the answer for this? Testicular artery is a branch of abdominal aorta. Abdominal aorta. So ये flow chart याद रखना बच्चा. There are plenty of MCQs which get solved, which gets cleared. Testicular artery or ovarian artery, that is gonadal. Okay, very good, very good, very good. बोल सकते हो? What is the watershed area of inferior mesenteric artery and internal iliac artery? ये बोल सकते हो बच्चों? Inferior mesenteric and internal iliac. बोलो बच्चों बोलो. Answer is Sudek's point. Answer is Sudek's point. Where is Griffith's point? Griffith's point is junction of Griffith's point is junction of right 2/3 and left 1/3 of transverse colon. Left 2/3, junction of right 2/3 and left 1/3 of transverse colon. That is Griffith's point. Of right 2/3 is supplied by whom? Superior mesenteric artery, and left 1/3 is supplied by inferior mesenteric artery. The junction of right 2/3 and left 1/3 is known as Griffith's point. Griffith's point. Sudek's point lies at recto-sigmoid junction. Recto-sigmoid junction. There's an anastomosis between inferior mesenteric artery and inferior mesenteric artery. उसका branch is superior rectal artery with middle and inferior rectal artery. These are branches of internal iliac. So Sudek's point lies at the recto-sigmoid junction. There's an anastomosis between 2 main arteries. Main arteries कौन है? Inferior mesenteric artery and internal iliac artery. So which branch of inferior mesenteric artery बच्चों? That is superior rectal artery. And which branch of internal iliac artery? That's the middle and inferior rectal artery. Middle and inferior rectal artery. Clear है बच्चों? Is this clear? समझ में आया ये? So दो points है, एक है Griffith's point, दूसरा है Sudek's point. Griffith's point कहाँ पे होता है? At the junction of right 2/3 and left 1/3 of transverse column. And ये दो arteries के बीच में anastomosis है, anastomosis between the superior and the inferior mesenteric artery. And what is Sudek's point? Sudek's point lies at the recto-sigmoid junction, anastomosis between the inferior mesenteric artery, उसका branch superior rectal with internal iliac, उसका branch middle and inferior rectal. That is known as Sudek's point. Is this clear? हेलो 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 बच्चों, क्लियर है? Yes. All are tributaries of portal vein. Answer this. All are tributaries of portal vein except. Any guesses? Yes, where are the others? Dr. Nitin is answering, Dr. Shri is answering. Baki ke bachcho, where are you? Answer. Everyone try to answer. Be interactive. Galtiyan karo, that's fine. Yahan pe galtiyan karo, that's okay. But final exams, no mistakes. Chalo, answer this. Inferior pancreaticoduodenal vein. Yes, very good. Yes, yes, Shubh. Inferior pancreaticoduodenal vein drains into superior mesenteric vein. It drains into superior mesenteric vein. How is the portal vein formed? Portal vein कैसे बनती है बच्चा? Portal vein is formed behind the neck of the pancreas, right? So, what is this vein? ये कौन सी vein है? Behind the body of the pancreas. ये कौन सी vein है बोल सकते हो? Which is this vein? This is the splenic vein, and that's the superior mesenteric vein. This is the portal vein. Where is the portal vein formed? Formed behind neck of the pancreas. Okay, ये याद रखना. So the portal vein is formed behind the neck of the pancreas. And who lies on the uncinate process of pancreas? On the uncinate process lies superior mesenteric vessels. Yaad rakhna. On the uncinate process lies the superior mesenteric vessels. Clear? Okay, fine. So answers, the superior boundary of 𝐒𝐿ode's triangle is formed by. Yes, bachcho, come on. Superior boundary of 𝐒𝐿ode's triangle is formed by. Any guesses? Inferior surface of the liver. Very good. Inferior surface of the liver. What are the boundaries of 𝐒𝐿ode's triangle? बोल सकते हो? Boundaries of 𝐒𝐿ode's triangle. Anyone? Boundaries of 𝐒𝐿ode's triangle. Inferior surface of liver, common hepatic duct, what is this duct? Cystic duct. So cystic duct cystic duct, common hepatic duct, under surface of liver. Okay, so the boundaries of 𝐾𝐲 triangle, the cystic duct, the common hepatic duct, and the undersurface of the liver. Very good. Who's the content of 𝐾𝐲 triangle? Content bolo, content of 𝐾𝐲 triangle is cystic artery, yes, and lymph node. Contents of 𝐾𝐲 triangle is cystic artery and there's a lymph node. ठीक है? That's a content. Okay, perfect. Answer this. Deep inguinal ring is a defect in. Answer this. Deep inguinal ring is a defect in. चलो बोलो बच्चों, बोलो. Easy है. This you must be knowing. Answer this. Deep inguinal ring is a defect in transverse abdominis aponeurosis. Transverse abdominis aponeurosis, and the superficial inguinal ring is a defect in external oblique aponeurosis. That's a superficial inguinal ring. That's a defect in external oblique aponeurosis. The deep inguinal ring is a defect in transverse abdominis. ठीक है? Lymphatics भी है. Yes, शुभ lymphatics also. Lymph node बोला ना, and lymphatics. एक मिनट. The superficial inguinal ring is a defect in external oblique aponeurosis. The deep inguinal ring is a defect in what? Deep inguinal ring is a defect in what? बच्चों क्या बोला आपने? Fascia transversalis है. Deep inguinal ring is a defect in fascia transversalis. Transverse abdominis aponeurosis नहीं है. It's the fascia transversalis actually. Deep inguinal ring is a defect in fascia transversalis. ठीक है? Okay. Answer this. All the following arteries supply the pancreas except. Answer this. Chalo, answer this. All the following arteries supplies the pancreas except gastroduodenal artery. Yes, इसका branch is superior pancreaticoduodenal artery. इसका branch है superior pancreaticoduodenal artery. Superior mesenteric artery इसका branch है inferior pancreaticoduodenal artery. Pancreatic branch of splenic artery. So who does not supply the pancreas is the inferior mesenteric artery, right? The inferior mesenteric artery does not supply the pancreas. Gastroduodenal artery का branch is superior pancreaticoduodenal artery which supplies the pancreas. Inferior mesenteric artery does not supply. Superior mesenteric artery का branch is inferior pancreaticoduodenal artery and the pancreatic branches of splenic artery. Very good. Answer this. A patient underwent extraction of third molar tooth, and after this the patient was observed to have a loss of sensations from the anterior 2/3 of the tongue and the floor of the mouth. Which nerve is most likely to be damaged? Yes, answer this. Loss of sensations from the anterior 2/3 of the tongue. So which is the nerve which supplies the anterior 2/3 of the tongue? It is the lingual nerve. Right? Loss of sensations from the anterior 2/3 of the tongue and the floor of the mouth. So answer is lingual nerve. Clear to all of you? Answer is lingual for this. So tongue का nerve supply पता है ना आपको? What is the nerve supply of tongue? Yes. Tongue का nerve supply. Anterior 2/3, posterior 1/3, posterior most part, general sensations and special sensations. Yes, any guesses? General sensations or special sensations? Any guesses? यस बच्चों बोल सकते हो. Chorda tympani. Anterior 2/3 of the tongue who supplies? Okay. Anterior 2/3 of the tongue who supplies is chorda tympani, and chorda tympani is a branch of facial nerves. This is just 1 minute. Okay, let's start. Anterior 2/3 of the tongue. General sensation, special sensation. General sensation is what? General sensation is touch, pain, temperature. Special sensation is now that taste. Special sensation is taste. So general sensation is anterior 2/3 of the tongue. What is that? Label. Special sensations is chorda tympani. Posterior 1/3, both general and special sensation is glossopharyngeal nerve, and posterior most part is vagus nerve. Clear to all of you? Clear now, bachcho? Yes. So general sensations, anterior 2/3 of the tongue is lingual nerve, which is a branch of fifth nerve, mandibular nerve. Special sensations is chorda tympani. Right. Posterior 1/3, both general and special sensations is glossopharyngeal. Posterior most part is vagus. Oh, just 1 moment. 1 minute. Okay, fine. Chalo, clear to all of you? Hello, hello. Now checking hypoglossal nerve. What number is that? Hypoglossal nerve, which is a cranial nerve. Hypoglossal nerve, that's it. Nerve. What does the hypoglossal nerve supply? It supplies motor to the tongue. It supplies the muscles of the tongue. All the muscles of the tongue are supplied by hypoglossal nerve except all the muscles of the tongue are supplied by hypoglossal nerve except palatoglossus. Palatoglossus which is supplied by pharyngeal plexus, right? All the muscles of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by pharyngeal plexus. Accessory nerve, what is the number? Yes, number accessory nerve ka number is spinal accessory and cranial accessory, number 11. Inferior alveolar nerve is a branch of what? Inferior alveolar nerve is a branch of mandibular nerve, right? Inferior alveolar is a branch of mandibular nerve. It's a branch of mandibular nerve. Clear to all of you? Okay, fine. Answer this. A patient complains of pain and swelling behind the ear, below the ear. He cannot close his left eye completely and is having difficulty in eating food. Which nerve is most likely to be damaged? Answer this, bachcho. हाँ, Shri, ये कैसे होगा? Look now, complaints of pain and swelling below the ear. It's below the ear. He cannot close his left eye. So who is that? Ocular is paralyzed. Difficulty eating the food. Buccinator is gone. So which nerve? Answer is facial nerve. Answer is facial nerve, Shri. Greater auricular nerve supplies the skin. Skin को supply करते. It's a cutaneous nerve. So answer for this is facial nerve. Clear to all of you? Okay. So, I'm able to see your comment. ठीक है बच्चों? Okay, till here. Answer this. What vertebral level is for the red color line is shown in the image? Yes, answer this, bachcho. What vertebral level? The red color line. समझ में नहीं आया नितिन? थोड़ा रिफ्रेश कर लो नितिन. Refresh कर लो थोड़ा सा. I'm trying to talk in the maximum voice which I have. Okay. थोड़ा रिफ्रेश कर लो, वापस रिफ्रेश कर लो. हेलो बच्चों, इसका आंसर क्या है? इसका आंसर क्या होगा? Okay, what is the answer for this? What is the vertebral level? The rest of you are able to hear, no? What is the vertebral level for the red color line? Answer is L4, L5. That's the highest point of iliac crest. Highest point of iliac crest, if you join a line, it corresponds to the vertebral level L4, L5. L4, L5. Okay, answer for this is C, L4, L5. क्लियर है बच्चों? हाँ, that's a 𝐿/Q. Yes, शुभ. Ductus arteriosus develops from which pharyngeal arch artery? बोल सकते हैं कोई ये? Ductus arteriosus. ये ductus arteriosus होता क्या है? It connects the pulmonary artery to the arch of aorta. The ductus arteriosus in fetal life. हाँ बच्चा, what should we mark for umbilical? Umbilical level. Umbilical level is T10. Shri, umbilical level is T10. Wait, we will come to this. मैं बोलता हूँ. I'll tell you. Shri, just wait. Ductus arteriosus, what does it connect? It connects the pulmonary artery to the arch of aorta, है ना? This ductus arteriosus after birth becomes what? Ligamentum arteriosum. Ligamentum arteriosum. Okay. L3, L4. L3, L4. Shri, vertebral level is L3, L4. Okay. Fine. So answer for this is the sixth arch artery. Sixth arch artery. So ductus arteriosus is derived from the sixth arch artery. Sixth arch artery से क्या बनता है? Pulmonary artery. Pulmonary artery. And this sixth arch artery connects, becomes the ductus arteriosus. The ductus arteriosus connects the pulmonary artery to the arch of aorta. Okay. This is derived from the fourth arch artery on the left side, on the right side. On the left side forms the arch of aorta. On the right side forms the subclavian. Fifth arch artery disappears. Third arch artery forms the common carotids. Okay. Third arch artery forms the common carotids. Fourth arch artery on the left side forms the arch of aorta. On the right side forms the subclavian artery. Fifth arch artery disappears. Sixth arch artery forms the pulmonary artery. And ductus arteriosus. Pulmonary artery and the ductus arteriosus. Clear? ठीक है. Okay, so the third arch artery से क्या बनता है? Common carotids. Fourth arch artery on the left side forms the arch of aorta. On the right side forms the subclavian artery, right subclavian artery. Fifth arch artery disappears. Sixth arch artery forms the pulmonary artery and the ductus arteriosus. Ductus arteriosus. Later, if I get time, I'll explain this to you. Answers. चलो बच्चों आंसर कर रही है. This is an easy MCQ. Identify the muscle X marked in the given image. Answer this. Genioglossus. Very good. Genioglossus. And what is the action of genioglossus? Bachcho, what is the action of genioglossus? It protrudes the tongue. The genioglossus protrudes the tongue. It is also known as the safety muscle of the tongue. And it is known as the safety muscle of the tongue. Genioglossus protrudes the tongue. It is known as the safety muscle of the tongue. And paralysis of, I mean, if the hypoglossal nerve is damaged, the tongue deviates to the same side of the lesion. It is known as the safety muscle of the tongue. Genioglossus protrudes the tongue to the opposite side. Okay, याद रखना. ये genioglossus क्या करता है? Genioglossus is going to protrude the tongue genioglossus protrudes the tongue to the opposite side. देखो, genioglossus is known as the safety muscle of the tongue. Why? Because ये tongue को protrude करता है, but ये tongue को protrude करता है opposite side पे. मतलब the right genioglossus deviates the tongue to the left side, and the left genioglossus deviates the tongue to the right side. समझ में आ रहा है बच्चों? So now you tell me, अगर मेरा right hypoglossal nerve is injured, the right genioglossus is paralyzed, who becomes powerful? Left, and the left would deviate the tongue to right side. The left would deviate the tongue to the right side. So in lesions of hypoglossal nerve, tongue is deviated to same side. In lesions of hypoglossal nerve, the tongue is deviated to the same side of lesion. Clear है बच्चों? समझ में आया ये? Are you clear about this? See, once again, genioglossus protrudes the tongue to the opposite side. ठीक है? अब जो right genioglossus है, हाँ, yes. So right genioglossus है, that would deviate the tongue to the left side, and left would deviate the tongue to the right side, right? So अगर right hypoglossal nerve injury हो गया, right genioglossus paralyzed हो गया, who becomes powerful? Left, and the left will deviate the tongue to right side. So in lesions of hypoglossal nerve, the tongue is deviated to the same side of lesion, same as with fifth nerve. Yes. Okay, just remember all the MCQs. Bachcho, answer this. Protraction of the jaw. Yes, protraction of the jaw is due to which of the following muscle? Protrusion of the jaw. Protrusion. कौन करता है ये? Any guesses? Protrusion of the jaw is done by, answer is lateral pterygoid. Lateral pterygoid. Lateral pterygoid के दो actions हैं. One is depression and second is protrusion. Depression and protrusion of the mandible. What's the elevation? What is the action of temporalis? Temporalis का action क्या है बच्चों? बोलो, temporalis का action क्या है? Temporalis का action होगा elevation and retraction of mandible. Elevation and retraction of mandible. ठीक है, that is temporalis. And medial pterygoid and कौन है? कौन अच्छा है? Masseter. का एक्शन क्या है? Elevation. ठीक है, ये याद रखना. ठीक है. What is the action of lateral pterygoid? It's depression of the mandible and protrusion of the mandible. What is the action of temporalis? It is elevation and retraction. And medial pterygoid and masseter does what? Elevation of mandible. हाँ, ये सब muscles of mastication है बच्चों. ये चार भी है ना. All these are muscles of mastication. All these are muscles of mastication. Clear to all of you? Serratus anterior is also known as boxer's muscle. Boxer's muscle is serratus anterior. So very good. Clear to all of you? ये सब muscles helps in mastication. ये muscles of mastication, they help in mastication. चलो बच्चों, answer this. All are related to the facial nerve except, any guesses? All are related to facial nerve except stylomastoid foramen. Yes, stylomastoid foramen से facial nerve बाहर निकलती है. Posterior belly of digastric. Yes, the facial nerve supplies the posterior belly of digastric. Parotid gland. Yes, the facial nerve lies within the parotid gland, right? The facial nerve is lying within the parotid gland. So the facial nerve is not related to maxillary process. Right? The facial nerve is not related to the maxillary process. It comes out through the stylomastoid foramen. It lies in the parotid gland. It supplies the posterior belly of digastric. उसके साथ कौन सा मसल होता है? Stylohyoid. So facial nerve does not is not related to the maxillary process. Clear है बच्चों? Clear to all of you? Okay. All the following parts of the superior orbital fissure except, yes, any guesses? Easy है. Easy MCQ बच्चों. Easy MCQ. Answer this. Any guesses? Mandibular nerve. Yes. Mandibular nerve goes out through which foramen? Foramen ovale. है ना? Foramen ovale से mandibular nerve जाती है. Okay. I'll just draw the superior orbital fissure for you. Superior orbital fissure. Have a look at this. So ये है superior orbital fissure, right? ये है common tendinous ring of Zinn. हाँ? So ये हो गया lateral, ये हो गया medial. Superior orbital fissure, that's a common tendinous ring. So this is lateral, this is medial. Now what passes through the lateral compartment of the superior orbital fissure? This is LFT, lateral frontal trochlear nerves. Intermediate compartment से बन जाता है दो fibers of oculomotor, बीच में nasal ciliary, and this is abscess nerve, and this is a vein, inferior ophthalmic vein. Okay, so what is L? L is lacrimal, L is frontal, T is trochlear nerve. Okay, ये सब nerves है. Trochlear is number 4. OC is third nerve. Oculomotor nerve, that's third nerve. AB is sixth nerve. And what is NC? Nasal ciliary. Okay बच्चों, ये जो lacrimal है, lacrimal, frontal and nasal ciliary, ये किसके branches हैं? These are the branches of ophthalmic nerve. Lacrimal, frontal and nasal ciliary, these are the branches of ophthalmic division of trigeminal nerve. Clear to all of you? So what passes to the lateral compartment of superior orbital fissure? Lacrimal, frontal, trochlear. Intermediate compartment से oculomotor बीच में nasal ciliary and नीचे abscess. And what passes to the medial compartment? The inferior ophthalmic vein. Clear to all of you? Fine. Okay. Good. Yes. Answer this. Which is the dangerous layer of scalp? Easy MCQ है. बोलो बच्चों. Answer this. Which is the dangerous layer of scalp? That is the loose subapparatic tissue, loose areolar tissue, or the loose subapparatic tissue, because there are a large number of veins here. Veins. ठीक है ना? Easy है. That is easy. Large number of veins here. So infection directly goes to the sinuses inside the skull. So this layer of the scalp is known as the dangerous layer of scalp. Okay, that's another easy MCQ. Answer this. Foramen transverseum is found in. These are very easy MCQs, bacho. Some Very easy MCQs. Foramen transverse are seen in. Any guesses? Foramen transverse is seen in. Yes, cervical vertebrae. Cervical vertebrae. What passes through the foramen transverse? What passes through foramen transverse is vertebral artery, है ना? Vertebral artery, right? Anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. ये कहाँ पे होता है? These are present in the skull. In the skull, बोलते हैं ना? Anterior, middle, and posterior cranial fossa are present in the skull. Cervical vertebrae में होता है foramen transversarium, and what passes to the foramen transversarium is the vertebral artery. Vertebral artery. Vertebral artery is a branch of subclavian artery. It's a branch of subclavian artery. Clear to all of you? Answer this. Maxillary nerve is transmitted via. Yes, bacho, come on, bacho, come on. Maxillary nerve is transmitted via. Any guesses? Bolo, I'm looking at the screen. Bolo. Maxillary nerve is passing through which foramen? Foramen rotundum. The maxillary nerve passes through the foramen rotundum and continues as infraorbital nerve. Infraorbital nerve. The maxillary nerve. Acha. Girl wearing maxi and rotating. Okay, great. So maxillary nerve passes through the foramen rotundum, comes out through this foramen here. This foramen is present below the orbit. इसे बोलते हैं infraorbital foramen. The nerve is now known as the infraorbital nerve. Yes, very good. So अगर MCQ आता है maxillary nerve continues as, your answer is infraorbital nerve. Foramen ovale से क्या जाता है? This you must be all knowing. MALE. Yes, बच्चों. Who's M? Mandibular nerve. A. Accessory meningeal artery. L. Lesser petrosal nerve, and E. emissary vein. Foramen lacerum, foramen spinosum से क्या जाता है बोलो? Middle meningeal artery and nervous spinosus. Middle meningeal artery and nervous spinosus passes to foramen spinosum. Foramen lacerum. Can anyone tell me what passes to foramen lacerum? बच्चों, what passes to foramen lacerum? Anyone? Any guesses? Which is this number of MCQ? Which MCQ number is this? Because the numbers are not written on the MCQ on this. So what number is that? Can anyone tell me? Which MCQ is going on now? Number? Hello, bacho. I have to again keep on logging in and logging out because the comments are not seen. Yes, bacho. Shri, which MCQ number is this? 44. Okay, fine. Okay, Dr. Nitin, fine. Clear? Foramen lacerum से क्या जाता है बच्चों? Can anyone tell me what passes through the foramen lacerum? That's the internal carotid artery. Bacha, internal carotid artery. What passes to foramen lacerum is the internal carotid artery and the sympathetic plexus. Thank you. What passes to foramen lacerum is the internal carotid artery and the sympathetic plexus around it. Sympathetic plexus around it. ठीक है? Foramen lacerum. Clear to all of you? Okay, perfect. Coming to the next MCQ, answer this. All the following matches are true except. कोई बोल सकता है? अब इसमें भी है ना. All the following matches are true except. बोलिए. हाँ. What is A? A कौन है? A. A is caudate nucleus. A is caudate nucleus. B कौन है? B. This is thalamus. B is thalamus, right? What is C? C क्या दिख रहा है? C. हाँ बच्चों, what do you see? Think is C. C is lentiform nucleus. C क्या ऑप्शन दिया देखो. C is lentiform nucleus, right? Lentiform nucleus and D is wrong. D is not internal capsule. D कौन है बोलो? D कौन है? So A is caudate nucleus, B is thalamus, C is lentiform nucleus. What is D? D क्या मार्क किया? D is external capsule. External capsule. That's not internal capsule बच्चा, वो lentiform nucleus के बाहर है. That is known as the external capsule. External capsule. Okay, that is external capsule. That's not internal capsule. Internal capsule कहाँ होगा बच्चा? Internal capsule will be present here, right? Here. So internal capsule will be present between the caudate nucleus and thalamus medially and lentiform nucleus laterally. Incisura, external capsule के बाद incisura आता है. Yes, external capsule के बाद incisura आता है. Answer this बच्चों. A patient presented where physician noted that all extraocular muscles have been paralyzed. The most probable level of lesion is. Shri, एक मिनट. I can't see it properly. See, white matter में point किया ना श्री. White matter में point किया है तो वो external capsule है. अगर grey matter है वो तो वो incisura है. Incisura है ना is like this. ये ऐसे होता है. That is incisura. It's a grey matter. White matter है तो वो external capsule है. ठीक है? ठीक है श्री. Yes, answer this. All extraocular muscles have been paralyzed. The most probable level of lesion is. Yes, where is the level of lesion? Look, extraocular muscles is supplied by which nerve? Third nerve, fourth nerve, and sixth nerve. Third nerve, fourth nerve, and sixth nerve. बराबर है. So third nerve का nucleus कहाँ पे होता है? Where is the nucleus of third nerve located? In the midbrain. In the midbrain at the level of superior colliculus. In the midbrain at the level of superior colliculus. Fourth nerve का nucleus is in the midbrain at the level of inferior colliculus. And sixth nerve का nucleus कहाँ पे है? बच्चों, sixth nerve का nucleus is located where? Can anyone tell me? The nucleus of sixth nerve is located in the pons. Nucleus of sixth nerve is located in the pons. ये याद रखना. Third and fourth nerve nucleus is in the midbrain. So a majority of extraocular muscles are paralyzed. Then the answer would be midbrain. Not all नहीं आएगा इसमें. A majority of extraocular muscles are paralyzed. The lesion would be in the midbrain. Because just sixth and a sixth nerve का nucleus is located in the pons. Facial colliculus याद है आपको? Facial colliculus. So the fibers of facial nerve winds around the abducens nucleus. तो ये कहाँ पे होता है? Pons में. Okay, sixth nerve nucleus is in the pons. So, but majority of muscles are paralyzed. So answer is midbrain. Answer is midbrain for this. Clear है बच्चों? ठीक है? Clear till here. एक last time पूछता हूँ. Clear till here. Okay, great. Very good. Answer this. Corticospinal tracts crosses at the level of. Anyone? corticospinal tracts are pyramidal tracts. Pyramidal tracts, they begin from area number 4, they cross the internal capsule, they line the midbrain, they come in the pons, they come in the medulla, and they cross in the lower medulla. Lower medulla में ये cross करता है. The corticospinal tracts cross in the lower medulla. Okay, just have a look at this. Corticospinal tracts. Area number 4. They begin from area number 4. They come in the internal capsule. Which limb? Posterior. ये बहुत MCQ है. Important है. ये बहुत important MCQ है. Corticospinal tracts present in which part of the internal capsule? That's the posterior limb of internal capsule. ये आता है midbrain में. What part of the midbrain is this? Crus cerebri. Then comes the pons, basilar part of the pons. Then comes the medulla. They form elevations in the medulla, जिसका नाम है pyramids. And finally, spinal cord, anterior horn cell. Spinal cord का anterior horn cell. So they begin from area number 4, they cross the internal capsule, they line the posterior limb of the internal capsule, they come in the midbrain, crus cerebri, pons, basilar part. Which part of the pons? Basilar part. In the medulla, they cross, they form elevations, that's pyramids, and then they go to the anterior horn cell of the spinal cord. Anterior horn cell of the spinal cord. Clear? So that's the corticospinal tracts or the pyramidal tracts. एंड फिर यहां से कहा जाएगा वो मसल्स की तरफ. मसल, राइट. व्हाट इज दिस पार्ट नोन एज? दिस एंटायर थिंग फ्रॉम द कॉर्टेक्स टू द एंटीरियर हॉर्न सेल, इसे क्या बोलते हैं? अपर मोटर न्यूरॉन. फ्रॉम द कॉर्टेक्स टू द स्पाइनल कॉर्ड, दैट्स अपर मोटर न्यूरॉन, एंड फ्रॉम द स्पाइनल कॉर्ड टू द मसल, दैट्स लोअर मोटर. लोअर मोटर न्यूरॉन. ये याद रखना, LML UML पैरालिसिस आता है. हाँ, व्हाट इज LML? फ्रॉम द स्पाइनल कॉर्ड टू द मसल, दैट बिकम्स लोअर मोटर न्यूरॉन, एंड द अपर पार्ट इज नोन एज द अपर मोटर न्यूरॉन. परफेक्ट. राइट. ओके, come to the next MCQ. Glossopharyngeal nerve supplies which of the following glands? बच्चों, come on, answer this. Glossopharyngeal nerve supplies which of the following gland? Answer this. A. Glossopharyngeal nerve supplies the parotid gland. Very nice. Very good, bacha. Very good. You know the name of the nucleus of the glossopharyngeal nerve जो parotid को supply करता है? What is the name of the nucleus of glossopharyngeal nerve? The name of the nucleus is inferior salivatory nucleus. जो inferior salivatory nucleus है ना brain के अंदर, this inferior salivatory nucleus of the glossopharyngeal nerve is going to supply the parotid gland. Rest all the glands in the head and neck are supplied by whom? Facial nerve. All the glands in the head and neck are supplied by facial nerve. And वो facial nerve का वो कौन सा nucleus है जो सारे ग्लैंड्स को सप्लाई करता है? हाँ, तो सबमैंडिबुलर एंड सबलिंगुअल ग्लैंड्स को जो सप्लाई करता है, द नेम ऑफ द न्यूक्लियस इज सुपीरियर सलाइवेटरी न्यूक्लियस. जो लैक्रिमल ग्लैंड को सप्लाई करता है, दैट इज lacrimatory nucleus. So superior salivatory nucleus and lacrimatory nucleus belongs to which nerves? Facial nerve. And which glands they supply? तो वो मैंने बोला आपको. And glossopharyngeal nerve supplies which gland? Parotid gland. What is the name of the nucleus of glossopharyngeal nerve जो parotid को supply करता है? That's inferior salivatory nucleus. समझ में आ रहा है बच्चों? Are you able to follow this? Clear? Okay. answer this. Most medially located nuclei of the cerebellum is, ये easy है, हाँ? Okay, I'll tell you this. I'll tell you with some other topic. I'll tell you, हाँ Shri, I'll tell you, हाँ I'll tell you. Just wait. Most medially located nucleus. I'll repeat, बच्चा. I'll repeat in some other MCQ. Wait. एक और एक MCQ है nucleus ambiguous वाला. I'll tell you. Most medially located nucleus of the cerebellum is nucleus fastigiae. Nucleus fastigiae. बाकी का न्यूक्लियस है ही नहीं ना cerebellum का. बाकी का न्यूक्लियस है ही नहीं cerebellum का. So what are the nucleus of the cerebellum? Dentate. फिर nucleus globose, nucleus emboliform and nucleus fastigiae. So सबसे medial is fastigiae and सबसे lateral is dentate nucleus. Dentate nucleus सबसे lateral होता है and nucleus fastigiae सबसे medial होता है. जो highly evolved nucleus है that is the dentate nucleus है ना. Dentate nucleus is the highly evolved nucleus of cerebellum. Okay, easy. अच्छा देखो, I'll just tell you one thing. एक मिनट, I'll just tell you one thing. See, for example, I'll tell you one easy now. Shri, understand glossopharyngeal nerve. अब glossopharyngeal nerve क्या सप्लाई करती है? Parotid gland. Glossopharyngeal nerve supplies the parotid gland. ये अपने को पता है. Glossopharyngeal nerve supplies the stylopharyngeus muscle. Glossopharyngeal nerve supplies the tongue. ये sensory है ना, it is sensory, carries sensations from the tongue. So to supply the parotid gland, देखो, मतलब like you have, suppose you have 1,000 rupees. Suppose you've got 1,000 rupees. So 1,000 rupees के 300 rupees you keep for something, 500 rupees you keep for something, है ना, you distribute, you divide your money. वैसे ही the nucleus of a nerve के पास एक न्यूक्लियस नहीं होता, because nerve has to supply many things. So nucleus will be many different nucleus होंगे. Like one nucleus of glossopharyngeal nerve is going to supply the parotid gland. एक दूसरा nucleus होगा वो stylopharyngeus को supply करेगा. एक तीसरा nucleus होगा glossopharyngeal nerve का, which is going to supply what? Tongue. So there are different nuclei for the nerve, for any nerve, कोई भी nerve का, glossopharyngeal हो या facial हो, any nerve will have many different nucleus. Fine, understanding? Now I'm asking you, what is the name of the nucleus of the glossopharyngeal nerve जो parotid gland को supply करेगा? तो ये nucleus का नाम है inferior salivatory nucleus. So inferior salivatory nucleus किसका nucleus है? Glossopharyngeal nerve का. And what is this nucleus going to supply? Parotid gland. Stylopharyngeus को supply करने के लिए glossopharyngeal nerve का separate nucleus है. What is the name of that nucleus? Nucleus ambiguous. But nucleus ambiguous है ना, it's a common nucleus for three nerves. It's a common nucleus for the 9th nerve, 10th nerve and cranial axis. ये थोड़ा सा difficult है. ये सबसे difficult part है in the entire anatomy to understand. So मतलब ये जो nucleus ambiguous है ना, it belongs to three nerves. It belongs to the 9th nerve, it belongs to the 10th nerve and it belongs to the cranial accessory nerve. अब glossopharyngeal nerve carries sensations from the tongue. So to carry sensations from the tongue, glossopharyngeal nerve का एक separate nucleus है, and that's the nucleus of tractus solitarius. Nucleus of tractus solitarius. But again, the nucleus of tractus solitarius is a common nucleus for three nerves. Tongue याद रखना, tongue. So it's common nucleus for the 7th nerve, 9th nerve and the 10th nerve. Tongue याद रखिए बच्चों, tongue. टंग के स्पेशल सेंसेशंस कौन कैरी करता है? स्पेशल सेंसेशंस एंटीरियर 2/3 से Chorda tympani, that's facial. Posterior 1/3 से glossopharyngeal and posterior most part से vagus. So एक common nucleus होता है for this three nerves. That's the nucleus of tractus solitarius. समझ में आ रहा है ये आपको बच्चों? श्री समझ में आ रहा है? So glossopharyngeal nerve, what it supplies, वैसे उसके nucleus होंगे. So number 1, inferior salivatory nucleus supplies the parotid gland. Number 2, nucleus ambiguous supplies the stylopharyngeus muscle. Number 3, nucleus of tractus solitarius supplies the posterior 1/3 of the tongue. समझ में आ रहा है? यस नितिन, समझ में आ रहा है? श्री, शुभ, द रेस्ट ऑफ यू? थोड़ा सा डिफिकल्ट है ये बच्चों, थोड़ा सा डिफिकल्ट है, मतलब इट टेक्स टाइम टू अंडरस्टैंड दिस. बट अगर ये समझ में आता है ना, ऑल योर एमसीक्यूज विल बी क्लियर. ठीक है, बोलो, you let me know this is clear or no. वेरी श्री, नितिन क्लियर है ना? श्री समझ में आया कि नहीं? ओके चलो बोलो. So nucleus ambiguous is the common nucleus form. So I told you I'll be explaining the nucleus in some other MCQ. I have explained it. Nucleus ambiguous is a common nucleus for. अभी बोलो. Nucleus ambiguous is a common nucleus for 9, 10th and the cranial accessory. 9, 10th and cranial accessory. And nucleus of tractus solitarius. It's a common nucleus for 7, 9 and 7, 9 and 10 cranial nerves. That's nucleus of tractus solitarius. ठीक है? Clear to all of you? Okay. Nerve carrying sensations from the posterior 1/3, from the anterior 2/3 of the tongue is called. Nerve carrying sensations from the anterior 2/3 of the tongue is called. What is that nerve? Yes, hello बच्चों, है ना आप लोग? Are you there or no? That's nerve of Risberg. Nerve of Risberg is the sensory branch of facial nerve. Sensory branch of facial nerve is known as nerve of Risberg. What is Arnold's nerve? It's the auricular branch of vagus. Arnold's nerve is the auricular branch of vagus. Jacobson's nerve is the tympanic branch of glossopharyngeal nerve. Tympanic branch of glossopharyngeal nerve का नाम है Jacobson's nerve. And criminal nerve of Grassi is a branch of vagus. It's a branch of vagus. Clear to all of you? यहाँ तक क्लियर है? बोलो, just let me know. Is it clear till here? Yes, Nitin, clear? Shubh, Shri, rest of you also answer ना. Rest of you also थोड़ा सा ये करो, बातचीत करो, interact करो. Okay, answer this. Left spinal lemniscus carries which fibers? बोल सकते हो? Spinal lemniscus क्या carry करते हैं? They carry crude sensations. Crude sensations क्या होते हैं? Touch, pain, temperature. And they carry from the opposite side. Opposite side से sensations लेके आते हैं. So left spinal lemniscus will carry right-sided touch, pain, temperature. है ना? Right-sided touch, pain, temperature would be carried by left spinal lemniscus. And what is the medial lemniscus going to carry? Fine sensations. Fine sensations क्या होते हैं? tactile localization, tactile discrimination, stereognosis, vibration, proprioception. Tactile localization, tactile discrimination, stereognosis, vibration and proprioception. ये कौन carry करेगा? Medial lemniscus. These are fine sensations. And spinal lemniscus क्या carry करेंगे? Crude sensations of the opposite side. Opposite side. Clear? Okay. Answer this. Pranshu, cerebellar connection to the other parts of the brain is projected to which cell? देखो cerebellum है ना बच्चों, cerebellum is mainly sensory. Cerebellum के पास सारे inputs आते हैं. All the input, all the sensory input comes to the cerebellum. But there's only one nucleus which sends output from the cerebellum, and that is Purkinje cell. Purkinje cell is the only motor output from the cerebellum. Only motor output from the cerebellum. Okay, it's the only motor output from the cerebellum. Golgi cell नहीं है नितिन, Golgi cell नहीं है. Cerebellar connections जो होते हैं ना, the only motor output from the cerebellum is through Purkinje cell. Purkinje cell है उसका आंसर. Purkinje cell है. Basket cells and अच्छा, okay, no problem. Just watch that up. Watch that. वो आपने डाउट पूछा था ना श्री, that I have told. वो थोड़ा सा देख लो. Golgi cells and basket cells are again sensory input to the cerebellum. Okay, what structure connects the Broca's and the Wernicke's areas? बोल सकते हो? What is Broca's area number? Broca's area and Wernicke's area, that is number 22, and Broca's area is number 44, 45. 44, 45, that's number 22. Clear? So what connects the Broca's and the Wernicke's area? That is known as the uncinate fasciculus or the arcuate fasciculus. So Broca's area is 44, 45, that lies in the inferior frontal gyrus. Wernicke's area lies in the superior temporal gyrus. The one which connects the Broca's and the Wernicke's area is known as the arcuate fasciculus or the uncinate fasciculus. Uncinate fasciculus. Okay. ये क्लियर है ना बच्चों? ये पता है ना? हाँ, I need not go into details of this. हाँ, बस ये MCQ is very important. Remember this. चलो some general topics. Which of the following is a pneumatic bone? चलो आंसर बच्चों. This is very easy. Which of the following is a pneumatic bone? Pneumatic क्या होता है? जिसमें air spaces होते हैं. So answer for this is frontal bone. Frontal bone is a pneumatic bone. And this air spaces, उसका function क्या है? They make the bone light in weight. They add resonance to the voice, and they act as air conditioners. They humidify the air. ठीक है? So frontal bone है. They reduce the weight. Second, they act as air conditioners. They humidify the air, and they help in resonance of the voice. ठीक है? Answer this. Which type of joint is present at the arrow mark in the diagram? This. What is this joint? बोल सकते हो? What is the name of this joint? Secondary cartilaginous joint. Secondary cartilaginous joint. Example is pubic symphysis, intervertebral joints, manubro, sternal joint. Joints में बहुत MCQs आते हैं. So secondary cartilaginous joints, pubic symphysis, intervertebral and manubrosternal joint. Primary cartilaginous joint is also known as synchondrosis. So what is synchondrosis? Synchondrosis is a primary cartilaginous joint. An example of primary cartilaginous joint, the joint between epiphysis and diaphysis. Joint between epiphysis and diaphysis. Yes. Yes. Okay, Shri. Okay. Fibrous joints are of three types. Fibrous joints होते हैं sutures, syndesmosis, and तीसरा कौन है? Gomphosis. Sutures, syndesmosis, gomphosis. ठीक है. So इन सबके एग्जाम्पल एक एग्जाम्पल याद रखना. What happens to the primary cartilage joint after certain years? They ossify. They are converted into a bone. They ossify. है ना? Primary cartilage joints after certain years they ossify. Clear? Shindylisis is an sutures. Shindylisis is an example of sutures, बच्चा. Shri. Shindylisis is an example of sutures. Sutures में क्या होता है? Suture, suture, lambdoid suture, है ना, serrate suture, then denticulate suture, फिर wedge and groove suture, फिर ये आता है shindylisis. Okay. Answer this. Congenital deformity is shown in the image. बच्चों अभी ये image में the brain is seen, मतलब the skull is not formed. The skull is not formed. The brain is exposed. Sometimes the brain is also not formed. So that is anencephaly. यहाँ पे the vertebral column is not formed, so the spinal cord is exposed outside. That is meningomyelocele. So meningomyelocele and anencephaly का combination क्या होता है? Craniorhynchisis. Craniorhynchisis, right? It's a combination of anencephaly as well as meningomyelocele. So that is craniorhynchisis. ठीक है? Anencephaly is, and this defect is due to non-closure of the neural tube. Okay, when does the anterior neuropore close? कोई बता सकता है? The anterior neuropore closes at what week? Or what day? Anterior neuropore closes by 25th day of intrauterine life, and the posterior neuropore closes by 29th day of intrauterine life. 24th is fine. Okay, 28 भी बोलते हैं, 28, 24, 25, that's fine. Okay, answer this. Flabella in. Flabella is a sesamoid bone. Yes, flabella is a sesamoid bone. It is present in the lateral head of gastrocnemius. That's a sesamoid bone present in the lateral head of gastrocnemius. Pisiform is present in the tendon of flexor carpi ulnaris. Pisiform bone is present in the tendon of flexor carpi ulnaris. Then patella. Patella is present in quadriceps femoris. Patella is present in quadriceps femoris. Rider's bone. Rider's bone is present in the tendon of adductor longus. जो हॉर्स राइडर्स होते हैं ना, हॉर्स राइडर्स, पीपल हु राइड हॉर्सेस, द मीडियल एस्पेक्ट ऑफ द थाई रब्स अगेंस्ट द सैडल ऑफ द हॉर्स. जो सैडल होता है हॉर्स का, उसको फ्रिक्शन होता है, एंड इन ड्यू कोर्स ऑफ टाइम अ सेसमॉइड बोन इज फॉर्म्ड इन द टेंडन ऑफ एडक्टर लॉन्गस, जिसे हम बोलते हैं राइडर्स बोन. राइडर्स बोन. So flabella is a sesamoid bone in the lateral head of gastrocnemius, pisiform in flexor carpi ulnaris, patella in the tendon of quadriceps femoris, and rider's bone is developed in the tendon of adductor longus. Adductor longus. ठीक है? Just remember this. Identify the type of epithelium. बोलते हो? वो डेज में आता है बच्चे, डेज में आता है. The MCQ will be in day. Which day of intrauterine life? 25th and 29th day. So week wise you can calculate. That is also fine. Okay, Shri. Chalo, answer. What is the type of epithelium? Umbrella shaped cells. Very good. Excellent. Umbrella shaped cells hai. Ye dekho, umbrella shaped cells. So this is an example of transitional epithelium. Transitional epithelium is urothelium. Very good. Urothelium. Keratinized stratified squamous epithelium कहाँ पे होता है? Skin. हाँ, skin. Non-keratinized stratified squamous epithelium कहाँ पे होता है? It's in the esophagus, vagina, Non-keratinized stratified squamous epithelium is in esophagus, vagina. Pseudostratified ciliated columnar epithelium is in the respiratory system. Trachea, mainly trachea. Pseudostratified ciliated columnar with goblet cells. That's respiratory epithelium. Pseudostratified ciliated columnar with goblet cells. Yes. Clear? Okay. Coming to the last MCQ of the day, bachcho, all are muscular arteries except, I think this is the last MCQ. All are muscular arteries except. All are muscular arteries except. Any guesses? दो टाइप ऑफ आर्टरीज होती है. सी आर्टरीज आर ऑफ टू टाइप्स. Arteries of two types. One is known as muscular and the other one is known as elastic. Elastic artery is also known as distributing. Muscular artery is also known as conducting. अभी बोलो. इजी है, इजी है, बोलो बच्चों. So elastic artery is also known as distributing artery and muscular artery is also known as a conducting artery. So all are muscular arteries except aorta. Aorta is a actually elastic artery. It is a distributing artery. Distributing बोलते हैं उसको, distributing. Okay. Small arteries are muscular artery, big arteries are elastic arteries, distributing arteries. उसमें elastic fibers बहुत होते हैं. तो when the artery contracts, no, तो blood flows and elastic recoil की वजह से the blood flow is maintained. Okay. So aorta is an example of elastic artery or a एक minute, just one moment. One moment. I made it opposite. Muscular artery is known as distributing and elastic artery is known as conducting. थोड़ा सा चेंज कर लो उसको, चेंज कर लो. Okay. Fine. So aorta is an example of aorta is an example of distributing artery, conducting artery. That's an elastic artery. Elastic artery. ठीक है बच्चों, clear to all of you? So muscular arteries muscle fibers जाते होते हैं. Elastic arteries में collagen, this elastic fibers are more. Collagen fibers are there, but elastic fibers are more. ठीक है students, is this clear to all of you? All these things will be uploaded on PW Med Telegram channel. Thank you for your listening. Things clear to all of you बच्चों. कुछ doubts है तो बोलो. कुछ doubts है तो बोलो. fallopian tube भी है. Yes, fallopian tube भी है. Okay, thank you to all of you. Thank you so much for this patient listening and I hope things are clear to all of you. If there's any doubt, just let me know. Okay, thank you. Thank you to all of you. Okay, we'll stop here.